A very good morning and a warm welcome to everyone present here. I welcome you all for the international conference organized by the Department of Psychology and Internal Quality Assurance Cell, IQAC, Chevalier T. Thomas Elizabeth College for Women in collaboration with Tonight Trust on prevalence and importance of maternal mental health globally. We start our program with an invocation. I request Ms. Sharon of Second Psychology to sing the prayer song.
They shall be showers of blessings. This is the promise of love. They shall be seasons refreshing, sent from the Savior above. Showers of blessings we need. Mercy drops round us are falling, but for the showers we plead. They shall be showers of blessings, precious reviving again. Over the hills and the valleys, sound of abundance of rain. Showers of blessings we need. Mercy drops round us are falling, but for the showers we plead.
Thank you, Sharon. Maternal mental health is not only important for every mother's, but it plays a major role in deciding every person's well-being in a family. And I request Dr. Alima Zera, Head Department of Psychology, CTTE College for Women, to welcome everyone and to elucidate the concept launch.
A very good morning, everyone. I heartily welcome you all to this international conference on prevalence and importance of maternal mental health globally, organized by the Department of Psychology in collaboration with Internal Quality Assurance Cell of Chevalier T. Thomas Elizabeth College for Women and Tonight Trust, sponsored by Lions International and Very Awakening Trust. I'm happy to welcome Thiru L. Paramale, IAS retired, Managing Trustee and Correspondent, CTTE Trust, for his valuable presence and blessings, and also someone who always appreciates and encourages our efforts throughout our endeavors. I welcome you, sir. I welcome our beloved principal, Dr. S. Devi, who is a pillar of strength, who constantly encourage, guide, and motivate teachers and students in all the activities. I welcome you, ma'am. I welcome our dear Vice Principal, Dr. Quincy Asha Das, who's always been there for guiding and supporting us in the right direction. I welcome you, ma'am. It's my pleasure to welcome our first key speakers, Mrs. Smita Rajan, co-founder, Tonight Trust, a trauma-trained integrative therapist and a dance and movement therapist. We are very happy to have you here with us today, ma'am. I'm very glad to welcome you, ma'am. It's my pleasure to welcome our second keynote speakers, Mrs. Aisha Chandni, founder of Mothers Club, managing trustee of the Hidayah Welfare Trust for Women, and Action Committee Coordinator of Association of Lactation Professionals of India. Happy to welcome you, ma'am. I welcome Dr. Subhashri, co-founder Tonight Trust, CDR SIPA Ilan Tamil Komahan, Commander in Indian Navy, M. Shivasubramanian, Managing Trustee, Very Awakening Trust, Bhaktariva, founder, Very Awakening Trust to this conference. I also take immense pleasure in welcoming all the heads of the departments and faculty members to this conference. My hearty welcome to all the guests, research scholars and students from various institutions to this conference. I once again welcome the eminent speakers and guests from different walks of life who have come here to share their knowledge and vast experience with the student community. The objective of this conference is to increase awareness about the prevalence, challenges, and impact of maternal mental health in the community and globally, to encourage discussions on how mother's well-being impacts the well-being and development of the infant, to understand evidence and research related to mother's maternal health in the perinatal period. The theme of the international conference is the prevalence and importance of maternal mental health globally. Along this journey, there will be plenty of knowledge enhancing sessions that broadly cover a wide range of topics related to Thinking Healthy program, the invisible struggle supporting perinatal mental health, approaches to maternal mental health, integrative approaches, impact of birth and breastfeeding on mental health. At this conference, we have contributions coming from 16 colleges. Each paper proposal will be evaluated by 4 chairpersons. Subthemes of the conference are maternal distress and resilience, family and social support for maternal mental health, coping with changes during pregnancy and postpartum, paternal mental health, optimism and family functioning, child's behavioral and emotional problems and mother's mental health, maternal mental health and special education, evidence-based interventions for perinatal mental health, antenatal and postnatal depression, stigma, access and advocacy of maternal mental health. We hope this conference would help students expand their mental horizon and help to increase awareness about the prevalence, challenges, and impact of maternal mental health in the community and globally. I request all the students from across the country to make use of this conference to the best of their abilities. Thank you all once again and have a blessed day.
Thank you, ma'am. May I have now call Ms. Pauline Christina to give the introduction about Mrs. Smita Rajan, co-founder, Tonight Trust.
A very good morning to the honorable dignitaries, faculties, and participants of today's session. I'm Pauline Christina of 3rd Psychology, and I'm delighted to introduce our esteemed guest speaker for today, Mrs. Smita Rajan, who is a trauma-trained integrative therapist and a dance movement therapist. With a studies, psychology, and communication, Smita brings a multidisciplinary perspective to her work. Her expertise extends to professional storytelling, developmental milestones, and sign language, reflecting a diverse skill set. Smita has dedicated over 15 years to being a dancer trainer and has spent the last 4 years as a practicing therapist. Currently, she plays a pivotal role in programs and outreach at Tonight Trust, a social enterprise she co-founded. Behind her organizational role, Smita engages with communities through story moment sessions in Mumbai schools, fostering creativity and emotional well-being among children and teachers. As an integrated therapist, Smita tailors her approach to each client's unique needs. Notably, she shares her expertise as a faculty member at the master's and postgrad level courses of dance and movement therapy at Sanchati Healthcare Academy, Savitri Bai Phule University, Pune. Smita's commitment to inclusivity is evident in her work with special individuals, including those with cerebral palsy, mental health disorders, physical disorders, abnormalities, and delayed milestones. In Mumbai, she has also made significant contributions to marginalized communities and survivors of psychological trauma. Smita's impact extends beyond therapy, as she has presented workshops on various topics. These include Introduction to Dance and Movement Therapy and its application, Body and Behavior, Perspectives of Body-Based Therapy in Psychology, Caring for Caregivers, and many more. Please join me in extending a warm welcome to Smita Rajan. We are honored to have her share her expertise and insights with us today. You're welcome, ma'am.
Thank you so much, Pauline, for that, for those lovely words. Very humbled and always in gratitude. Let me at the onset start by thanking the entire department of run at the by the taken care at the helm by Dr. Alima and her entire team. And it's a fact, and I know that they have been talking about this for the past few months. So it's nice to be a part of something that has culminated so beautifully and a dream that has been seen for a long time. And thank you so much for having me. Before we start the talk and the presentation, just about a few things. Number one is that I have a bit of a gruff throat today, and I generally sound a tad bit sweeter. So I have a rough throat today. So during the course of my talk, it's possible that I might pause to take a sip of water, and I hope that it is okay with everybody. And at any time, if my voice goes unaudible, I just want one of the people in the organization team to kind of unmute themselves and let me know, because as I'm presenting, I will not be able to see messages and read chats. So if you can do that for me, then we are good to go. And before we begin, so before I kind of start the session, I just want to do a check with the PPT. Alima ma'am, I hope that's okay.
Yes, ma'am, please go ahead.
Yeah. All right. Is everybody able to see this as I'm presenting? Without any disturbance. All right. That's good.
Yes, ma'am.
Okay. All right. So I'm going to stop presenting, because who wants to see a presentation first thing in the morning, especially in a beautiful conference which talks about women, empowering women, and reaching out and talking to probably women who are interested, young women who are interested to know about what we are doing and why we are here. So before we get into the entire discussion about what it is and why we are here, I think already Dr. Alima has set the pace, because she kind of gave a brief intro about the need and the description about the topic. Let's take a bit of a pause and listen to a nice story. I know Pauline told you that I'm a storyteller, but that's not what we're going to do today. But let's listen to something, and then let's reflect a bit. Let's take, say, a young girl who's probably 24, 25 years of age. And probably, let's call her Suja, because that's the name that we have used in our flip books, right? So one of the things that Suja is battling right now is that she has been told that she is carrying a child, and everybody around is extremely happy, because this is something that's been in her mind for a while. And she feels that this is the right time, and I am all ready to be here and do the thing, whatever is needed. And it's all exciting, is what she thought. But when now the news has come, and now there is a confirmation from her gynecologist, and everybody around is celebrating. Her husband is on cloud nine. Her not the hospital, but the cloud nine happiness. All of the community, all of the people around her, the family, are celebrating, and they are giving sweets to each other and all of that. But Suja feels very, very numb, and she's not able to articulate her feelings. But there is a lot of thought process that is going around inside. Right? She wanted it. She has got it. But what do I do? What are the next steps? Why does this happen? This happens to more than 90% of women. And I don't say this, evidence says this. There are papers which say that 90% of women feel numb, disconnected, especially during the first trimester. Why does this happen? We have been having children right from day one of evolution. Having babies is not alien to humans at all. But why this immediate disconnect, this numbness, this disassociation? All of these feelings are stemming from the fact of being unsure about how the journey is going to be. What's in store for me? What's in it for me? Probably Suja is battling thoughts about, okay, I now know it, but what more? How do I take this further? What do I do about this? What do I do with this new information? What do I do with this new child? I mean, you see the chaos? That's perinatal mental health for you. While we are talking about why and the do's and the don'ts and the prevalence, which is a big part and a need, and which is why we are here, I would like each of you who is watching this, every young person out there, I am talking about every aspect of a human who is watching this out there and is a bit curious about what is this that they were talking about, because having babies is something that's very, very natural, and it's a very natural process. But when we talk about the mental health aspects, that there are so many changes that have happened to existence for human beings, that we have to up our game when it comes to keeping the mother and the parent happy during the process of motherhood and parenthood. And that's how the story begins. We are all in it together, and we can do and make a difference in the community together. And that's how the story goes. And that's how we envisioned about why we are here, why Tuna is doing, or why CTTE is doing an awareness programs like this. And I really hope and pray that such programs that you're organizing is going to be only the start to many, many more such interesting programs with a lot of participation from the community. And I really hope and pray that this is only the first step. So on that note, I'm going to start my presentation. Perinatal mental health, and that's why we are here. Now, a little bit of a information about a little bit of an information about Tune's core areas. As Tune is an organization that we, with all our warm, feelings towards the community, we wanted to make a difference. And when we started off, and we are still toddlers, by the way, we are still 4 years old only. But when we started, the vision was to be in the space of building trauma and resilience amongst the young adults, because psychological trauma was something that was not spoken much of. But as we were in the field, we kind of warmed our feet into the knowledge that why does resilience hit, or why does resilience become something that is difficult at that particular age group? And then, being more in the field, and with more or a lot of our advisors and equipping ourselves, we kind of trail back. So a human who feels insufficient, who feels difficult, and who finds life's challenges thrown at them to be difficult and unable to cope, is generally termed as a person who is probably not resilient, and or is probably who's getting there. Where does resilience start? And that's where the perinatal mental health happens. Childhood and in utero. Evidence suggests that childhood and in utero is the space, or is the time period, in which the majority of coping mechanisms mentally and physiologically happens for a human being as a species. So when we talk about building trauma and resilience, what are we really talking about? We are actually talking about going down to the root of where it all starts. And therefore, Tune's interest in the perinatal mental health side. We have seen that when we talk to mothers and we make them aware about their mental health, and when we talk to them about how they can take agency and how they can do things in order to make a change, shift their thought process, shift their feelings, we have seen that it has worked to create a change. And that change is not only about the mother. So when we talk about perinatal mental health, it's not about mother, father, father. What we are really talking about is making a change at the start, so that the community which is going to be formed, just like the child in utero, is going to be resilient and is going to be more happy and more productive. And that's what we want. We want a happy, healthy community for our future, because that's what holds a positive future. Why are we talking about this? I kind of covered this in the beginning of the talk. Evolution is a natural process. Pregnancy has to be a happy occasion. That is the general tendency of the community. That is the general tendency how people feel, people believe it is. Pregnancy is a happy occasion. Having the ability to hold nature in its abundance is a happy occasion. It's very, very powerful. But there is also a matter of fact that there is a prevalence and there are risk factors associated where poor mental health of the mothers makes perinatal mental health a global health mission. What are we talking about when we say global health mission? Perinatal mental health programs have to be garnered towards the the situation is such that we are looking at this as from a global perspective, which is why when CTT came up with the topic as having a global perspective, I thought it's saying all the right things, doing all the right things, right? And this is not just me, this is not just us sitting in India talking about this, but globally, WHO has recognized that there is a need, there are risk factors prevalent when we target a mother and take care of her needs during the difficult or the vulnerable time that she holds the baby or she breastfeeds the baby or she is taking care of the baby. At that time, if a mother feels supported, there is a high chance of reduction of this prevalence. There is a high chance of reducing the risk factors associated with the perinatal mental health on a global scenario. All right. On this point, I would just like to ask if any of you have any thoughts and reflections, or is there any way in which we can get any suggestions, feedbacks, reflections from the people who are watching us? So, can I ask CTT team to kind of? I'm just doing a check-in here. So, is there going to be any questions? Is there going to be time for the questions only at the end, or are people allowed to also reflect in the middle? Anybody from CTT?
Hello, ma'am. This is Mrs. Lavanya. At the end of the session, we'll be having a question answer session.
All right. Okay. So then I'm just going to go on, and I really hope that everybody is with me and the momentum is not lost. And if you have any thoughts, any reflections while I'm talking and while I'm presenting, it would be a very good idea to just use the pen and paper and make notes and come back and we can talk about it at the end of the session. Right. So when we talk about what is the prevalence, what are we really talking about when we talk that perinatal mental health is a global situation, it is a prevalent problem. Now, perinatal mental health comes in different, the importance of prevalence of perinatal mental health can be seen as comes in different facets. So there are various levels of depression that we talk about. Postpartum depression is one where, and then there are baby blues, and then there is stress, there is anxiety. So today I'm not going to go into detail about what it is, because that is something that I think Dr. Najia is going to be covering later today. But what we're really going to talk about is that what's happening in our country. What are we talking about when we talk about perinatal mental health and the prevalence of perinatal mental distress in India? So 1 in 5 mothers scan, or 1 in 5 mothers, they score high when it comes to perinatal distress. And almost 20% of mothers in India at a time have excuse me, shown to showcase symptoms of perinatal distress and postpartum depression. Now, what the symptoms are, we will come to very shortly. During the period of the time right from the conception till the child is about a year or 2 years old, the mother's body goes through a lot. Why does this happen? Because it is not only one body that is being equipped, right? There are 2 bodies, and there is a lot of work that happens inside the body of the mother. The stress and the anxiety is also a reflection about all of the hormonal changes, the going up and the down and all of that. It's going to be very, very drastic at times, but that is natural. That is natural. There is a flux of estrogen, progesterone during pregnancy and even post pregnancy. There are impacts of that. There are going to be emotional changes because your hormones are going to spike up and low and up and low. And obviously, this is going to have an impact on your emotional response system. And physically, also, there is a lot of building in that the mother is doing. So in short, the mother's body is going through a lot of work. It is on double pedal, like I like to call it. It is on double pedal. And when that happens, there is a high chance that in order to maintain homeostasis, in order to find equilibrium, in order to find a balance, it just doesn't happen. And when that doesn't happen, what is the basic way that it can show? It shows in the aspects of distress, right? And the distress that shows, the symptoms that come up could be extreme anger at times, or having a disconnected feeling, exactly like the story of Suja that I started with. I don't even know what's happening right now. Do I have control over the situation? Unsure and self-doubt. These are things which become the symptom or become the presenting issue when we talk about the prevalence of postpartum depression. Why is this important? It is important that we talk about it because when we talk about perinatal distress, one of the common things that we hear when we go and work in the hospital and in the community is that எப்ப பார்த்தாலும் இந்த பொண்ணு வந்து சேடாவே இருக்காங்க, சிரிக்கவே மாட்டேங்கிறா, சாப்பிடுன்னு சொன்னா கூட சாப்பிட மாட்டேங்கிறா, அப்புறம் வாமிட் பண்ணிட்டே இருக்கா. Now, these are all the symptoms that the family is assertive and is talking about. But what is behind these symptoms could be a mental distress. And to add to this, there are many factors that contribute to add on to the the body which is already doing work on double pedal, which is already unsure, which is already relating with the change and the flux of emotions. To add on to this, there are some factors which contribute to the maternal distress. Now, all of these factors are the ones that we have picked up from the WHO, and so these are global factors. But a recent study, and I'm sure you'll be hearing more about it probably today, a recent study talks about intimacy violence as being one of the most prevalent risk factors for perinatal mental distress. Intimacy violence by the partner is one of the most talked about. Of course, globally we have prevalent factors like poverty, gender-based violence, lack of social support, right? And past trauma, right? But one of the most prevalent, and the study which is very recent as on 2023 brings out that globally domestic violence and intimacy violence are the ones which are biggest root causes of perinatal mental distress. And I think that speaks a lot about the level of emotional readiness in the community. Now, there are many ways to deal with the problem. But one of the best ways to deal with is directly working with the pregnant mother, allowing her and enabling her, empowering her to take agency of her body and making that shift. There are many ways to deal with the situations. And of course, that is something that we will discuss probably, as part of the today's conference. But one of the main things that we can definitely do is empowering a mother to take agency of her body and do what is good for her and her baby. And that is, I think, the lowest hanging fruit that we can address if we want to talk about making an impact in perinatal mental distress. And that is exactly the space that Tunai is in. Tunai right now is able to directly have sessions with the mothers, and mothers who show high who score high in the distress scale are given the right kind of capsules of, not capsules of internal consumption, but right kind of self-care capsules, right kind of awareness capsules, so that they can use it in their own lives and they can use it in their day to day, so that it will help them to garner towards a happy and a viable and a safe childbirth, and also result in the proper development emotionally and cognitively of the child. I'm going to spend a little bit of time on the aspect of past trauma. One of the things we definitely can talk about being uh, being an social enterprise which works in the space or understands a bit of trauma and how psychological trauma works. The aspect of trauma is like a it's like a ruminating chain. It just keeps going on and on and on. Why does this happen? Again, let's take a um, I mean, for want of a different example, I'm just going to talk about this. There was this recent movie where we are talking a lot about, the alpha male and the male chauvinism and the portrayal of the protagonist in the movie to be extremely toxic and aggressive and etc. Right? I'm not going to name the movie, but recent movie, and it's been there. Where a Bollywood actor has acted, and a Telugu director has directed it. But that's all I'm going to say. But we are talking about all of the right things. You're saying the right words. But what about the kids? What about the mother who has always been in distress during the time of her pregnancy? And how would have it have culminated? And why does this happen? Because the one of the parent figure or both of the parent figures have faced past trauma, have faced some sort of childhood abuse emotionally, physically, which is why the current keeps going and it doesn't stop. The chain goes on and on and on. Who can break the cycle? Who can break the cycle and who can break the cycle? And that is the question, which is where we come in, and we are trying to put in the thought and the aspect that a mother can break the cycle. If a woman is able to take agency about her situation of pregnancy, if a woman is able to understand what is good for her and her fetus in utero and her child right after birth, everything can stop. Everything can work towards stopping the cycle of rumination, and we can work towards a betterment. Right? One of these amazing visuals that I have come across recently, I wish I had used it in the presentation today, but it just comes up to me, is that there are these figures of a very old person, a person who's about 60, and then there is a person who's about 40, and then there's this child, and there's this very old person who is putting or saying toxic things, and there's this one who's 60 who's again saying toxic things to this person who is about 30. But the person who's 30 or a little younger, probably a new father, kind of says stop. And there is this amazing blanket saying that I break trauma. And that is the effect of taking agency, of not repeating the same mistakes over and over again, and understanding and breaking the chain and the circle of trauma, which is why trauma and perinatal mental distress works hand in hand. Right? I'm going to move on, but I would really like to discuss more about, whatever your thoughts are about the risk factors of mental distress. Yes, I see that I have missed out one of the aspect, physical factors. Now, when we talk about physical factors, a lot of time in the sessions when we are with the mothers, the physicality of it comes up a lot. What do I mean by physicality of it? Now, as a body-based therapist, for me, I always believe that healing or recovery begins from the bottom up, right? The body feels first. But that's not what I'm talking about. What I'm really talking about is it is easy to represent a physicality of an issue. A mother would come and say that I don't feel like eating and everything makes me puke. Or whenever my husband comes home in the evening, I feel that I'm getting really angry at him, but I really don't know why. These are easy problems or easy aspects of behavior that can be pointed. But there is another way of looking at it as well, the aspect of health. Now, as a body based therapist, I am moved to use the word psychosomatic presentations, but it's true. I mean, most of the developmental issues that happen during the pregnancy of the child, during the pregnancy of a mother for the child in utero or right after birth, stems because of health factors. And health factors are directly or in some way, okay, I'm going to be kind, are in some way related to the emotional health as well. Something very, very simple. A mother who is feeling totally numb. Let's take the example from the beginning. A mother who's totally numb to her situation and is unsure about how to deal with the situation. I'm not even sure how I feel right now about my pregnancy. When all of these thoughts are happening and there is a little bit of a chaos on her head up there, she's not going to really think or put her, for starters, hygiene on the front foot. She might not even think about what to eat, what not to eat, and the taste. She might not think about dressing herself up, enjoying the moment, taking care of her skin, right? There are so many pregnancy related products out there which are so attractive, right? But there are so many mothers who have no interest in pursuing or buying. Why is that? Because not because they don't care, it is because they are going through conflict, and that stems out as some sort of ill health showcase. Many times, I'm not going to go and say that 100% of the time, but many times. And that could be things like thyroid, any infection, or lack of blood. And by the way, we know and we are aware about a lot of organizations in Tamil Nadu who are working towards the anemia part of the pregnancy, wherein the tablets are given, and so basically there is support out there. There is support out there. There are people who are saying the right things and doing the right things. But the initiation of wanting to go and wanting to seek help starts from a mother's ability to think healthy. Now, that's a thought that I'm going to leave you all with, because as I'm told that all of you who have joined have some background in probable psychology or sociology or social work. So I'm just going to leave that thought and I'm going to move on, because I think I've spent a lot of time on this slide. So when I talk about perinatal distress, what does it look like? So what does unhelpful negative thinking patterns look like? What does it look like? It is definitely not something that, that looks like, that's the image that we have, right? Unhelpful thinking pattern. And this is one person who's always sad and thinking out like this, right? But unhelpful negative thinking patterns represent in very, very small ways. For example, just say that she does not want to take any tablets. She does not want to go for a walk because she feels, what's the point of all of this? I'm anyway going to get fat. What's the big deal? And these are very prevalent thought processes, because nobody is talking to her about things that are probably creating a chaos in her. This is all happening in her head, and everybody is only giving instructions, right? Feeling disconnected with the body, and hence feeling disconnected with the baby. not wanting to take care. So when we have sessions and we talk about bonding, 80% of the time, women, they are, they tear up. Majority of the times they tear up, and what they say is that I can feel my baby. I feel that I'm feeling so comfortable and so relaxed, and even with new birthed mothers, when we work with them in the hospital bedside, the connection, they well up because somebody took the time to actually tell them, stop overthinking, stop thinking about all of your negative patterns. Now let's see something positive. Breathe, connect, be with your body. And that's the click. And that is the click where bonding takes place, where the connection with the baby takes place. In fact, one of the things that one of the studies show that one of the top problems, or one of the top three problems, and the first is the question about body image. How will I get back to shape? Right? And this is prevalent globally. It is not just about you and me in this room, but this is a global scenario where a young mother wants to know how long is it going to take for her to come back into her old clothes. Does anybody talk about this? No. So when nobody talks to me about this, then I feel, is my problem so insignificant? So what do? I stop talking about it. But do I stop feeling it? No. So I keep feeling it, but I don't talk about it. I don't make it heard. So it's going to be, you see where I'm going? The chain starts. Right? So when we talk about perinatal distress, the job is not done by just diagnosing the mother and saying, oh yes, you've scored so high. You've, scoring high in your distress levels. What is she going to do with that piece of information? That's only going to add on to her anxiety and probably add on to her guilt, because she just feels that I just need to take care of the baby and I'm not able to take care of myself. Stopping with a diagnosis rather would be more impeding. And I am aware that all of you here are coming from the streams of healthcare and helping professions and all of that. But this is something that I'm going to ask you all to think about. Just diagnosing and leaving a mother with a diagnosis is not going to help her. The anxiety is going to only increase. So what do we do? The first thing to talk to a mother about is to tell her that whatever she's feeling, all the in her head, the chaos, the difference of the feeling of numbness and the inability to structure her thought patterns, her body patterns, tell her that this is normal. Why is this normal? Because your body is doing double pedal work. Simple. You are doubling shift. You're working all the hours. Your body is doing all of the work. So there will be repercussions. So what do? It's normal. It is normal. Now, when I say normal, I mean normalize her thoughts. I do not mean minimize her emotions, but I mean normalize. Tell her that this is prevalent. And there is a reason, because your body is doing double work. That is reassuring. Rather than telling, இதெல்லாம் எங்களுக்கு நடக்காததா, இப்படிதான் இருக்கும், என்ன நினைச்சிட்டு இருக்க? I have personally had past experiences where gynecologists and healthcare professionals have said to me, what do you expect? You're going to have a baby. These things happen. Helpful? No. Anxiety prone? Yes. Because I'm thinking, what did I get myself into? I thought this was a happy news. The story is almost the same everywhere. But when I talk about normalizing, what I'm saying is, when we normalize thoughts, we are telling the mother that she's not alone. And what she feels is something that is because of her body doing double shift of work. Simple. It makes so much sense. And what does it do? It allows me to take agency and take control of my situations. Okay, so if this is normal, where do I go from here? What do I do? What do I do? How can I equip myself? Come on, tell me more. Tell me more. Do you see that? The positivity starts when you start normalizing. And this is beautifully etched out in the Thinking Healthy program by the WHO. And I'm really excited that all of you are going to be witnessing the talk by Dr. Najia probably today, late this afternoon. And she's going to bring out all of these aspects, right? Yeah, so whatever we are talking about is a global situation. That's what we're talking about. Okay, so what happens to a mother during perinatal distress, or when her perinatal when her mental health is not addressed during the time of pregnancy or right after birth? Needless to say, complications during pregnancy and post birth. There is going to be a higher incidence of there is a possibility of higher incidence of miscarriage, bleeding, risk of bleeding, the risk of complicated surgery, higher rates of preterm births, right? Prolonged labor. This is something, interestingly, just about few weeks back, in one of these meetings, this was a paper which came up that prolonged labor has, shows patterns of prolonged labor is shown by mothers who score very high on the stress scale, through their pregnancy term, right? So prolonged labor, right? And increased mortality rates. That's the worst case scenario. So a mother, when it comes to pregnancy and complications during pregnancy and birth complications, all of these stem right from the time, all of these can be averted if the mother is supported, if the mother feels supported, if the mother is equipped to deal with her situation of pregnancy, if the mother is given the right information from the right people, and the mother is allowed to express and take agency of her body and be in control of what she can do with her body and with the baby, right? The second thing is poor bonding with the baby, right? Um, I'm just going to bring out this slide here before we go on. Right. I think this is such a amazing slide, because when we talk about connection and bonding, if you look at the two pictures, the picture on the left-hand side of the screen, where the mother feels disconnected, is distraught, and is looking away. And on the right-hand side, the mother is playful, and she obviously has a smile on her face, and which shows that the baby is probably making a connection, probably looking at the mom. And on the left-hand side, the baby has turned the face away, right? Now, at the onset, when we present a picture like this to a mother who is going through a hard time in pregnancy, what we are doing is we are normalizing it. We are telling her that the left-hand side, mother, what do you think is happening? And she thinks, and she herself is telling us that probably she's sad about something. And then what's happening with the mother on the right-hand side? Oh, she looks happy. All right, so what happened to the mother with the left-hand side? I don't know, probably some things are happening in her life, and you see where we go with this. And then when something's come up and she's able to express, what do we say? We say, yeah, that's normal. It's normal to feel that way, but you know what? There are ways to take agency and become the mom on the right-hand side. And there are various tools to do that. So what are we doing? We are encouraging her to reflect rather than ruminate. We are encouraging her to see that there is a way to shift. And the best part, she can do this. That's taking agency. One of the things that bonding does is also lactation. So the emotional connect that we talk about, how does it manifest into the child's development and well-being, is that a mother who feels emotionally disconnected, a mother who goes through a distressing time during her pregnancy, is also shown to have difficulty in breastfeeding post birth. And it's a very natural progression of events, I would say, right? I think all of us would agree it's a natural progression of events. So, what do? We can talk about why breastfeeding is important for the child and how breastfeeding can be a time to make a connect with the baby, why lactation is important. I think we have an amazing panel today where people are there to talk about lactation and the power of breast milk, which is true. It's a global accepted truth, universal truth, right? Taipal korandek taipal, right? That is the slogan, right? So lactation has its roots stemming back to mental health and physical health. And physical health, which is talking about promoting the overall health of the mother and baby, weight gain, good production of milk, nutrition, all tail back again to the mental health. Because if a mother is feeling good, is able to make a choice, is wanting to feel better, will make the right choices. When a mother feels safe, supported, and secure in her situation, she will make the positive choice and hence move towards positive thinking. And that's as simple as it gets. So it's not at all rocket science. The reason why and the beauty of the simplicity is that the entire idea of perinatal mental health is a psychosocial idea. Everybody in the community can participate. And later in the presentation today, I'm going to be talking about how we as students, you as students, can take agency and do something about the situation. Right? Yeah. All right. Very, very briefly, of course, uh, we're just going to take a minute to look at what are the manifestations or what happens to the child. The effect of perinatal distress on a child results in lower birth weight, right? Children are born preterm and hence are probably spending a lot of time in the NICU. Again, the golden hour period between the mother and child takes a hit. Probable reasons of delayed development, learning difficulties through the life, difficulty in coping to fluxes and changes, difficulty or delayed neuromotor development. Now, I'm in a space where I also work with children, especially with developmental disorders. And as a dance movement therapist, when I work with children as young as 4-5 years of age, it is many times I see that most of the manifestation in the child of delayed neuromotor development trails back to some sort of trauma that the mother has witnessed during pregnancy or right after birth, which could have been averted. Right? As a child and as growing into adulthood, and we talked about this a bit in the beginning, the resilience, the inability to cope and manage in difficult, challenging situations. So, needless to say, it impacts the entire generation. And I hope all of you would agree with me that when we talk about perinatal mental health, though we are addressing only the period from conception to the time till the child is, breastfed after birth, the impact that this crucial period has is actually lifelong. It has a spindling effect on the generations to come. Right? Which is why this work or this awareness or this scope that we are hoping to do, this work that we are hoping to do in this crucial time is going to have positive effects. Right. Now, well, an interesting slide again, and but I'm not going to spend too much time in this, but definitely something that I would really like to talk about. Um, when we talk about maternal mental health being linked to infant development, so we are actually marrying two aspects of psychology. I'm aware, I know it's very exciting. Developmental psychology, maternal mental health also is marrying together, but they are already married. They are concepts which are already intertwined, right? Why does a mother's mental health affect the child's mental health? Because there are studies which show or which suggest that when a mother during pregnancy faces trauma or has situations where spiked cortisol levels are displayed, it does transfer to the child. And when that happens, all of your HPA axis comes to work, your hormones are secreted, and then the child is in utero already going through so many fluxes, and it displays in the form of some developmental disorder if it is a continuous situation. When the mother is going through a tough time, the baby in utero takes the consequence of the physical, mental, and emotional dysregulation that a mother goes through. Which is why we keep hearing, culturally, we hear all of this, and probably just take a moment to reflect. Now party la வந்து age old what will they say, what all the grandmothers will say is that when a mother is pregnant, you have to keep her happy, do everything that makes her happy, make her the right food, encourage her to dress up, wear a lot of bangles, all the valagap, dress her up, and make her feel like a doll, like a queen, right? And all of these, because in those days, very very before, women also became mothers way early in their lives, right? And so, at 17, 18 years, probably at that time, dressing up and getting ready like a queen, like a princess, is something that makes women happy. And that's exactly what it is. So keeping her happy, what happens is happiness secretes a lot of happy hormones, and happy hormones makes you feel hungry. And then when you're hungry, you're eating healthy. And when you're eating healthy, your baby is healthy. And it just keeps going on and on and on. The age-old practices of being protective of the mother is only with the intention that a mother's wellness is directly related to the baby's development. So we have all of these practices, right? Why when if the tummy is facing upward, there is one practice. When it's facing too downward, then there is some stories associated with it. And wearing all of the bangles, valakap, in putting these jewelry in the legs, kind of makes the woman feel more grounded, and increases her connection with the ground as she is walking, and thereby elevating any chances of tripping, falling. And the sound alerts everybody around, and everybody is coming to take care of the mother and the baby, right? So our practices are all inclined towards the mother's wellness and development of the infant. But the only thing being that all of the culturally relevant practices should also up their game with the development that's happening in the world as well. How do we address a situation like this when we know that a mother's mental health directly affects the child's mental health? Is by helping a mother to first become aware about her body, her emotions, her thoughts. Sounds like rocket science, but it's actually not. My colleague here, I think she's today in the room, Subhashri, one of the beautiful things that she said very recently in one of our debrief sessions, she's like, just asking them, உங்களுக்கு எப்படி இருக்கு? நீங்க எப்படி feel பண்றீங்க? Nobody asks these questions because nowadays we don't live in those big setups. Majority of us in the city at least are living in nuclear setups. We have a job to do. We have elder kids to take care of. We have a husband or we have a wife, or things are really complicated. We have to take the bus probably to work, right? Nobody pauses and asks a mother this, right? Because the doctors are doing the stuff that doctors need to do, right? But asking a mother and being there for her, just something to very, very, very simple awareness question, right? Hey, how are you feeling today? Right? Not, we always do that. Hey, what's up? Right? It's come to that, but making it more specific, right? How are you feeling today? What's happening? உங்களுக்கு எப்படி இருக்கு? Right? உங்க மனசுல உங்களுக்கு என்ன ஏதான ஒரு குறை இருக்கா? Something like that. Something as simple as that. Making her aware about her physical and her emotional self. And the second and the most loveliest point is, in fact, our the flip book that we have made in order to work with the mothers directly is like a beautiful story of Suja, of whom I had just spoken about earlier. And it is so Suja and Potupati, and they both are having this lovely conversation. And how Suja, from unsureness, she's able to take a little bit of, she's able to become a little more aware. And then Potupati gives her an amazing suggestion: make your own safety circle. Who are the people that you will reach out to when you are feeling distressed? Right? Asking for help, creating a safety circle. That's the next step. She's not alone in this journey. Make a mother feel supported. In fact, that's Tune's mission. Every mother should feel supported every way. And this is something that we at Tune, like solvanga, parrot madri solradhu, this is exactly what all of our facilitators talk to when we meet mothers. Every mother needs to feel supported in her journey of pregnancy and motherhood. Adha அப்படியே தமிழ்ல translate பண்ணி, we say it in Tamil also. Right, for mothers when you're working, and in Hindi also. We're working now with Hindi mothers in Chennai, right? The third step, to normalize unhelpful thoughts. I think I covered this at length before as well, so I'm not going to spend much time. But normalizing avoids rumination into going into shame and guilt. And I have one job to do, is to have the baby, and I'm not able to do this. And you see where that goes? Totally unhelpful. Normalize it. Say that it happens, but there's a way, right? And the last, but definitely not the least, and the most impactful, I would say, or no, I'm not going to say that. Probably I'll say that something that makes it a complete package of how we can help mothers is by teaching her to take care of herself. What is most interesting about the work that we do with mothers is telling them that it's normal. We understand it, but this is what you can do. And then it becomes interesting. Because again, just diagnosing it and saying that, this is very, you're doing this, you're scored high and it's normal, is not helpful. Giving the closure by enabling her to address her thoughts. And for this, we have created toolkits where the mothers, once they join our groups, where we send them timely practices every week, some sort of engagement happens with the mothers, and these self-care practices are taught. Mood monitoring and emotion monitoring is taught. And then with mothers who are completely dysregulated and score very high in our scale, we have a special program called the Thinking Healthy program that is administered to the mother one-on-one. Again, something about which Dr. Naja will be talking. Yay! Right? That's the vision, and that's what we say, and that's what I spoke about, is that every mother is to be supported emotionally, physically, so that she delivers a healthy child who will grow into a healthy adult. So it's not about just the mother and the parenthood that I'm talking about. We are talking about creating the entire, giving the vision is to have the better, healthy, happy community. And that can happen by integrating approaches. So what are we taking away today? Here are a few things that, I would really like each one of us in the room and people who are listening and watching us via YouTube to take away from the session. is how do you help yourself? How do we individually can help ourselves? Seek the correct relevant information from trusted sources. It never helps to ruminate and ask another person who's also miserable. Yeah, it just, that just adds on to misery. So seek information from trusted sources. And now with the age of internet and information, this is something that is literally easy, right? Participate in your problem solving. Participate in creating a routine for yourself physically and mentally, and help others. One of the things that I in the sessions is especially while working with college students, talking to them about perinatal mental health, I think every session I keep saying that help people around you, and that is exactly what kindness is about. It just is so catchy. Kindness is very catchy, right? Help others, because they may not show that they have the same um, situation as yours. They might show otherwise, but help them if it is in your capacity. Help them. Talk about what you are doing right. Talk about what you are not doing right. Another interesting aspect is the um how can I support my partner? Because this is something that we come across many times, wherein fathers come into the session and say things like, na enna seiyano purilingle, na enna seiyano solunga naanga seirom. That's amazing. People are, the partners today are being more supportive, asking the right questions, right? I'm not saying that this is how it is, but I'm saying majority, at least half, 50% are at least asking the right questions, and they want to do something. What do we do? How do I support? Create a positive environment, safe environment, provide the emotional and financial and physical support by taking the mother for checkups. Many times we see mothers coming all alone for the checkups, and then they score high, and then we kind of ask them, next time when you come, why don't you come with your husband? And some people say that they're away, or they have they work elsewhere. So probably your mother or your mother-in-law or your sister or your neighbor, right? Mother needs to feel supported. That's it. Encourage the mother by giving positive affirmations about her body, about her ability to be a good mother. Because there was this case that I wanted to bring out, but I think it was just, I thought it would be too draggy. But there's this amazing study which shows that, ability to be a mother, am I even ready for this? And when we interact with the college students and young adults, this is a question that keeps coming up. I'm not even ready for it. Why is this happening? And probably this is what even Suja thought, right? The one that I spoke about at the onset of the session, right? Reassuring that it's possible, it's natural, and that it will happen is very, very supportive. Every mother feels supported. Be patient and calm with them. There will be emotional fluctuations. Like I said, body is on double pedal. Ensure how much you can that there is a good, healthy diet. Right? Now, these are things that partners can easily do in order to support mothers. Now, one of the good things that we talk about in our interventions with mothers is that we teach them about healthy habits. Now, these healthy habits are taught in sessions where we talk, and we actually virtually also we have sessions where we encourage mothers to join us, and we address these emotional well-being healthy habits. Being mindful, taking your breathing exercise, have a routine of breathing practices. Breathing practices are very, very effective. There are mothers who in the third, so I also train pregnant mothers as a dancing through pregnancy trainer. And I have mothers who recently joined, who is one who joined in the third trimester, is like, I want to do breathing. I want to learn breathing. Now, it's a bit too late, but at least you started, right? So Breathing and deep breaths correctly done properly also aids in childbirth and helps in elevating pain, says studies. So when we talk about emotional well-being and healthy habits, breathing practices is something that we often bring out in our self-care capsules. Take a walk, enjoy a stroll, look around, be happy, and through you the baby's having a good time. Mindful eating, engaging with all the five senses, becoming aware about your growing body, and treating yourself kindly, right? And quality of sleep, yeah, having a proper time for your circadian rhythm to work, very, very important for the mother and the child in utero and after birth as well, to set a sleep pattern for the child. Study says that if a mother during pregnancy has a good schedule of sleep and has a set circadian rhythm, there is a high incidence for the child to also settle with the sleep pattern. So these are information which we can talk about to mothers. We can tell them that these are the evidences, these are studies, right? You These are very basic, right? Using no, don't use electronic gadgets, sleep in a dark, quiet environment, and all of that. Now the last column, which is about building and strengthening social connections, is all garnered towards the idea that every mother needs to feel supported during her time of pregnancy and right after childbirth as a new mother. Building strong relationship with your spouse, with the people around you who care about you, asking for help when it is needed. It doesn't matter if it is very trivial. Sometimes asking for help is one of the bravest things that we can do. So asking for help, you don't have to do it all. Encourage your mother to have a good social support system. Yeah, sharing good habits and being generally active. Now this is the slide that I was talking about. As a student, what can we all do right now in this room to create an impact or do something about the perinatal mental distress situation or for perinatal mental health? Create social programs supporting mothers. One of the things that we encourage in our course, the perinatal mental health certificate course, is for the students to interact with their immediate community, creating a support group, talking to mothers, pregnant and new mothers, right? Create those social platforms. Use your institutions to help you do that. It's a very effective way to get started to work in the community and make an impact as well. Seek for psychosocial programs from NGOs like Tunai, or from healthcare workers, panchayats, PHCs, nurses, right? There is a lot of good work happening. Seek all the information of these programs and talk to other mothers about it. Be an informed person who can give relevant, correct information. Provide the social support that a mother needs. Engage in creating a healthy family environment for the mother. And this is something that we can do immediate right now. I mean, if there is somebody in your house, your sister, your brother's wife, your cousin, or even your help at home, if they are at this vulnerable time of pregnancy and early motherhood, try to create and engage with them in a uh, in a supportive manner. Be there for them. Help all the community workers who are into the psychosocial stream of while supporting mothers. This is where Tunai wants to be as an organization. And lastly, of course, be the community, because community is everybody. All of us make the community. So be the community that supports a mother and nurtures the children of the future. Thank you so much, everyone, for listening and being a part of this journey of 30 minutes. And that's about it from me for now. Yes, over to the team CTT.
Thank you, ma'am. The question answer session is open. Participants can leave your questions in the chat box. Ma'am, may I ask a question now, ma'am?
Yes, absolutely, Jessica, please.
So this question was from the chat box, ma'am. So it was like, what are some strategies for promoting resilience and coping skills among perinatal individuals?
Coping skills, Amma.
Perinatal individuals, ma'am.
I'm having trouble listening to. Did you say perinatal mothers?
Individuals. Individuals.
Perinatal individuals. So what are the yeah, excellent question. So like I said, breathing is one way, which is and breathing, when I say not மூச்சு இழுத்து மூச்சு விடுறது அப்படி கிடையாது, there are many ways of exhalation and inhalations and patterns that can be taught, like the long exhale, longer exhale for a longer time, the box breathing pattern, the alternative breathing pattern. And we have in our YouTube, we have a lot of information about it. And there are a lot of practices that you can follow. That is one. And the second is also engaging in fun activities that you people like to do. Create your own toolkit of, mandala drawing or coloring, and making your baby book, pregnancy book. And these are all practices which basically are reinforcing positive thoughts. And that is your resilience, right? So when you are feeling resilient and positive and hopeful, it definitely transcends to the baby. And these are some things that we don't need to give much thought. What do you really like doing? That's the question. And if you really like doing the stuff that I spoke about, great. Otherwise, going for a walk, talking to your friends. So all of these are engaging activities.
Thank you, ma'am. Ma'am, there's also another question. Like, what are the myths and misconceptions that are associated with maternal mental health or paternal mental health?
Adikortani, we need a separate session for that. Okay, so there are many myths and misconceptions that are there, of course, and of course, it's going to be very time consuming, but a few that I can definitely say is that when it comes to perinatal mental health, and we spoke about it as well, pregnant ஆனா இந்த மாதிரி தான் இருக்கும். Another, what is that? We say morning sickness, it is very natural. So there are mothers who get distressed because எனக்கு வாந்தியே வரலையே madam. That is distressing because everybody keeps talking about it. No two people's journey in motherhood is the same. So I think that is the first myth buster. Second is paternally also, since you asked about the paternal mental health, paternally also partners do go through some sort of distress because they don't know what's happening. They cannot physiologically and biologically understand what is happening. So that is also distressing. So the myth that fathers don't care and they have no job to do, I think it's shifting now, right? It is shifting. There are fathers who want to take some responsibility, who want to be a part of the journey. So these are some myth busters that I can talk about. Breastfeeding. There are so many myths around breastfeeding, right? First, starting right from the golden hour, that colostrum should be given or not given. There are so many myths, but my thought process is that, like I said, seek relevant and correct resource for support. Right, colostrum is extremely important for the child right after birth. The golden hour is very, very important right after birth. Mother and child should be fully breastfed till 6 months of age. These are all things which have, culturally, there are practices which are probably myths in it, but these myths need to be busted. But there are many, and I think it will be very, very time consuming for me to pull out all of these myths. I'm hoping that speakers in the next few sessions will be able to do it.
Thank you, ma'am. And also, there's a final question in the chat box. It's like, in terms of peer support groups and facilitating group therapy for mothers in pregnancy and postpartum stages, what kind of skills you think counselors need to be equipped with? What is the scope?
Yeah, that is an excellent question. One of the things, when you say that what kind of skills the counselors need, I would say the first thing that as counselors and facilitators that we can have is equip ourselves with the physiological knowledge about a woman's anatomy. That's something that we definitely need to know. We also need to practice all of those little nice skills, which is like active listening, compassionate inquiry, and unconditional support, and all of these definitely for sure. And another skill that I would definitely say is equip yourself with the right knowledge about the prevalence of perinatal distress. What are the manifestations? And also a skill of not to overstep in, because this is a very very delicate and vulnerable phase of a person's life into parenthood. So how not to overstep, and how to ensure that professionally they are sound and they know the right information, and the support that they give is not, you know is evidence based. That's what I would say. So upskilling, if you need to talk about professionally, equip yourself about perinatal mental health. So which is why we have kind of, we are probably going to have a professional perinatal mental health course, and hospitals are asking for professionals. So that's a great thing. They are asking for professionals to say the right thing, do the right thing, and be supportive as counselors. And we are in the midst of creating the course, and but more about it probably on a later date. But yeah, good things are happening, and keep yourself professionally skilled, learn about the physiology, know about a human body, how a human body, woman's body works. That's probably something that I can talk about.
And thank you so much for patiently answering our questions and enlightening us with your valuable information, ma'am.
Thank you, Jessica.
May I request Ms. Paul and Christina to welcome our next speaker, Mrs. Aisha Chandra.
Once again, it is my pleasure to introduce our distinguished speaker for this session, Mrs. Aisha Chandi, founder of the Mothers Club and managing trustee of the Hidayah Welfare Trust for Women. Aisha Chandi is a highly accomplished professional with a wealth of expertise in the field of maternal and infant care, holding an impressive array of credentials, including an MS degree, AMANI, CCCE, ICBD, ALCP, and IYCF. She has demonstrated her commitment to creating supportive spaces for mothers and infants. Her leadership as the Action Committee's coordinator for the Association of Lactation Professionals of India highlights her active involvement in advocating for the highest standards in lactation support. Aisha's impressive list of credentials includes being a CAPPA certified childbirth educator, ICEH certified birth doula, and advanced certified lactation professional. Additionally, she holds specialized certifications as a silent birth keeper, Dunstan baby language educator, maternal, infant, and young child feeding specialist, and postpartum counselor. With a passion for empowering mothers and infants, Aisha brings a unique blend of knowledge, experience, and compassion to her work. As a sought after speaker, she generously shares her insights at conferences, workshops, and events, contributing significantly to the discourse on maternal and infant care. Please join me in welcoming Mrs. Aisha Chandni, a dedicated professional whose expertise and advocacy have positively impacted the lives of countless mothers and infants. We are honored to have her as our guest speaker today. The session is all yours, ma'am.
Hello, everyone. Am I audible? Thank you so much for that, Pauline. Good morning to everybody. I hope I'm audible. Can somebody just confirm?
Yes, ma'am, you're audible.
Yes, thank you so much. Thank you for that lovely introduction. It's a great, great honor to be here. Right. Let me just share my presentation. So good morning to everybody. Just a second. Yeah. So before we start off, right, this is a beautiful opportunity, first of all, to be in this gathering because every single perinatal mental health session that I've addressed have been ones which are on an international platform. So I'm very, very honored. I'm very, very grateful to see that this is actually happening on an Indian platform as well, right? And honestly, it gives me great privilege to be amongst such great speakers, such great professionals. And I would like to tell a few words to Smita before I start off. Beautiful work, right? So much of what you said are things which was clicking in my mind, like yes, yes, we need more people saying that, we need more people doing that. So I'm going to be connecting a lot of dots here, right? So we know how to bring it into practice much better. To start off, today's session is about the invisible struggle, right? The invisible struggle is something a lot of women go through, silently keep quiet about. The people who have had the audacity to speak about it are often the ones who are most vulnerable. இதெல்லாம் ஒரு பெரிய விஷயமா, right? It's a dialogue which moms hear all the time, right? Why are you making it a big deal?
Ma'am, your voice is breaking.
Right? So what I am as a doula basically means that your best friend throughout your perinatal period, right? That is what a doula is, and that is what I do for my mothers. I handhold them, I coach them, I educate them, I support them through pregnancy, through postpartum. I'm not going to say that postpartum is 1 year after childbirth. It's not. I always tell my mothers that postpartum is never over, because there is no saying when postpartum is definitively going to end. So, that being said, let's jump into the topic. Because at the hello,
Excuse me, ma'am. Due to internet issues, your voice is breaking.
and take it forward from there. So let's start off. What is a doula? Yes, I'm sure you know what it means in your textbooks, right? You have the encyclopedias which tell you so much about it. But what perinatal mental health is actually about is how the mother is being supported, taken care of, right? In very simply put, how are we showering her, with what are we showering her, right? That's precisely what perinatal mental health is all about. Just a second, I think I'm having some issues with my network.
Excuse me, ma'am. Excuse me, ma'am. Your voice is not actually audible.
Are you able to hear me now?
Oh, yes, ma'am. But in the past, it wasn't audible. So,
Okay. I'm sorry, just a second.
Sorry for the inconvenience. We request all the participants to stay on mute. Thank you.
Hi, are you able to hear me now? Uh, Pauline, can you hear me now? Is my voice audible?
Oh, yes, ma'am, your voice is on. Thank
Yep.
you.
Okay, great. So I'm just logging in on two devices. Yeah. So sorry about that. Uh, yes. So I'll just go back a little bit because I don't know how much of that was. No. So, as you all know, the topic for today is going to be about the invisible struggle. We're going to talk a lot about challenges, about mothers, about postpartum, with a lot of emphasis on postpartum, because I want to carry it forward from what Smita had spoken about. I don't want to be repetitive of things which Smita has already covered in her session, right? So what I am, Pauline gave a beautiful list of certifications, but most importantly, what I am to the mother is I am a doula. Right, I am a doula. I'm a support person who supports the mother through pregnancy, childbirth, and postpartum. And another quote which I had said earlier, which I don't know if it got cut off by the internet connection, is I always tell mothers, once in postpartum, always in postpartum. There is no saying that postpartum is going to end at this set date or this set time. So we cannot tell the mother, hey, you can't still be in postpartum, you have to get better. Right? Personally speaking, my younger one is 2.5 years old. I think I'm still in postpartum. Right? I always tell this to the mothers. Don't let people tell you you cannot still be in postpartum. You should be over it by now. Right? That's not the case. It doesn't work like that. So I'm mostly a postpartum support person. I'm going to be talking to you all a lot about postpartum support groups, how we can nurture and build a community for the mothers to thrive in. Right, that's going to be a part of my presentation today. So moving forward, these are a rough list of topics I'm going to cover today, but please know I'm going to be giving most importance towards postpartum, because again, as I said, I don't want to make it too repetitive of what was already covered. So, what is perinatal mental health? So, when we start off with what is perinatal mental health, I'm sure you have your books which tell you the definition of perinatal mental health. I'm sure you know what it clinically means, right? What is perinatal mental health? The clinical definition, the ones from the dictionaries, I'm sure you know it. It's something we can even ask ChatGPT, and ChatGPT will tell us, right? What is there more to it that we need to know? Perinatal mental health is all about how we as a community of professionals are helping the mother, right? How are we helping the mother? How are we helping the father? How are we helping the family? It's not just enough to help the mother, right? There are times fathers are confused as to how do I help her? She keeps crying all the time, or she's angry all the time, or whatever I do, she has a problem with. I'll give you a small example for this, right? So I'm a birth support person. So I support mothers in labor. So when I support mothers in labor, right, already hormones are at its height in labor, right? So there are times where mothers are screaming at the husband saying, don't do this, don't do that, don't touch me. See, as a doula, rule of thumb is never touch the mother unless and until she wants to be touched. Because in labor, especially, what happens is there are times where you're able to cope with the emotions on your own. Your body gives you signs, your body gives you ways to cope with it. When you disrupt the mother's process of coping, she snaps out of her intuitive brain, right? And in labor, we want her to be in her intuitive brain, because her intuitive brain is what will guide her towards birth. But when we break that cycle of the intuitive brain, she detaches from that. She comes back to her social brain, her neocortex. We don't want her to come to her neocortex. We want her to stay in the intuitive brain. So I keep telling this to the fathers, but still the fathers are so anxious, right? So they go and try to help the mother. They try to, massage her back and all that. They're all great techniques. I'm sure a lot of childbirth educators do educate their husbands on being supportive. But sometimes the mother does not want to be touched. Especially if she's a mother who's gone through abuse as a child, she definitely does not want to be touched at a vulnerable point in her life. So there are times where moms yell out at their husbands saying, don't do this, go away from the room, or just leave me alone. Right? The fathers get so confused, they get so anxious, they come to me, they're like, Aisha, I'm just trying to help. What should I do? Right? What we actually do that time for the father is make them understand that, you know what, it's not you. She's actually going through a lot. Her body is giving her so many signals right now. She's just trying to focus on herself. See, this level of understanding at that juncture, no matter how many classes you have learned, you may not remember. So that's where a doula comes in to say that no, it's fine. She's absolutely fine. She's doing so beautifully well. And you are doing beautifully well. Right? It's not just the father who's going to interfere. Everybody is going to interfere with the mother. Right? That is how our society works. So there'll be the mother-in-law saying what is happening. There'll be the mother saying what's happening. Right? So when we talk about perinatal mental health, it's not enough to just talk about the mother. It is important to talk about the family as a whole, the societal structure as a whole. Because if we are going to individually help the mother is going to have to fight everybody else to get her way. But if we educate and support the family as a whole, what happens is they will at least try to support the mother better. I'm not saying they are going to, but they're going to at least try. So always classes when we take at the Mothers Club, we take a family oriented class. We call the husbands, we call the mothers, the mother-in-laws, the father-in-laws, whoever is going to be around her, right? We call them for the class. They'll be like, Nala vande enna pannuven class le. But the fact is, they have to be around to know what the mother will go through at that point. How can you actually help her at that point? So if we don't educate them about that, they are going to go back to their old ways and say that, Nagalam pulla pettikliya, Nagalam kolanda valakliya, right? They are going to say things like, we also gave birth to kids. We also grew up kids. We didn't do so much of drama like the way you people are doing, right? These are comments which easily come out of people's mouth. So, 1 in 5 women experience a mental health condition during pregnancy and the first year of postpartum. 1 in 5 women. It's a huge number, and this is from a very recent study at the WHO, which tells us this data. 1 in 5 is not a lot. Is not a significantly small number, right? So what do we need? We need an equivalent amount of professionals also who are equipped to guide these mothers. So that is 1 in 5 have a mental condition, right? A mental health condition of some sort. But there are 20% of them who go into suicidal thoughts, right? This is the extreme of psychosis. This is the extreme where it is pushed in. So if we don't address the 1 in 5 mothers, how are we going to reach the 20%? We're not going to be able to get there in time, right? So let's talk a little bit about the factors first, which influence, right? These are things which you probably already know, but I'm going to quickly brush through this so that I can focus on the postpartum and the support group part of it. Let's start off with biological factors. We all know pregnancy and postpartum is a time of immense change in the body. The body is changing, the organs are moving, they're all making way for this growing uterus. So to make way for the growing uterus, what's happening? Hormones are changing, right? Estrogen levels and progesterone levels are changing, your oxytocin levels are fluctuating, all of this is changing in the body, cortisol levels are changing, and your sleep cycles are already gone for a toss, so definitely those are also changing. So what this is doing is it is causing an imbalance in the body. When a physical change happens, there is obviously a hormonal change attributed to it, right? So both are happening simultaneously, and the mother gets help sometimes for the physical changes, but does not get help or does not know she has to get help for the hormonal changes in her body. Next comes the genetic predisposition, which is commonly known. Usually when we go in for gynecological checkup, the gynecologist usually asks history of the family, right? Does anybody have this? But yes, nowadays it's become an added bonus to ask if there's an history of stress, anxiety, depression in the family, because that is something which is very easy to know. It's easy to know how this mother grew up when she was a child, right? I'm sorry, not easy. It's important to know how she grew up. It's important to know the kind of household she grew up in. So one of my doula clients was abuse survivor, right? It was so important for me to know about her childhood because her childhood played a huge role in her birth. In her birth, when she had episodes of trauma and episodes of, she just didn't want to go through labor. She said, I can't do this Aisha anymore. I just want this to stop. If I did not know about her childhood, I would not have known how to help her. But the fact that we had a conversation about her childhood trauma, about her sexual abuse experiences as a child, made me understand how I should support her. Right? She was one mother I knew from the start, do not touch her. I knew I was not going to touch her during labor because that's what helped her get through labor. That's what helped her develop the confidence and the resilience to push through labor. Right? So, genetic predisposition matters in terms of their genes, their health disorders, because not only does it get passed over by genes, but it's also passed over to the mother based on her childhood and her past traumas gets carried forward. Right. Next is the psychological factors. Definitely factors like stress, anxiety, the history of mental issues, definitely body image concerns. Right. I'm so glad Smita brought this up in the previous session as well. Body image concerns we don't talk about. Right? அதெல்லாம் மாறதான் செய்யும். You should be okay with it. You're a mother. It's the biggest privilege for you to be able to breastfeed your child. I've heard so many people come and tell me, my breasts will start sagging. I think I don't want to breastfeed. It's ridiculous, but then I have to address the situation. At that point of time, I cannot laugh at the mother and say, what are you saying? Right? I'm laughing at you to make you understand that this is not okay for the mother to be fed with such information and her to base her life decisions on that. But body image concerns are actual genuine concerns which we have to address as a society. We are no more in the age where we say that these things don't matter. You know, தாயின்றது வந்து ஒரு ரொம்ப பெரிய ஸ்தானம். You should be very privileged to be here. You shouldn't complain about it. Sorry, that is not the situation and not the scenario we are in and not the scenario we should be in also. Right? Next is definitely social factors like the support system of the mother, financial situation. She wants to hire a nanny, she can't hire a nanny, she's not financially equipped to hire a nanny. Right? She doesn't have help at home, she doesn't have a maid, she doesn't have a cook, she should do all of the chores. A second time mother is so much more worse because she has to take care of an older child as well. Family dynamics, how supportive the family is of her, how supportive are they if she says, I want to go take a break, I want to take a nap, right? Is there somebody to watch the child when she takes a nap? You know, abroad there is something called a postpartum doula. So postpartum doula is a wonderful human being who comes home, takes care of the child, takes care of the mother during the postpartum. So you can hire them on like a daily basis. You can tell them like, I want you to come in every day from 10 to 2, or I want you to come every Monday, Wednesday, Friday. Right? You can hire them on those basis. But in India, we don't have all that. Right? But it's an amazing concept, and we should bring postpartum doulas. We should be supporting mothers more, because as we are moving away from the joint family system to the nuclear family system, we need to be able to take care of the mother also in her own independent space. Next, last but not the least, is environmental factors, which play a huge role. We all know traumatic experiences. When I say traumatic experiences, I just want to say this. I'm sure you guys know this, but I still want to say it because it's something I say all the time. What's traumatic for the mother is traumatic for the mother. Right? We cannot say that இதெல்லாம் பெரிய விஷயமே இல்லை. You had a normal delivery only, no? Why are you traumatized by it? I've heard people say that. People think that only if you have a C-section, it'll be a traumatic experience or an emergency C-section. People who've had a natural, normal delivery also can have a traumatic experience, right? Trauma means things did not go the way you thought it is going to go, or something which was done to you was disturbing to you. It may have been the right thing to do. What the doctor did or what the doctor said might have been the correct practice. It's not about malpractice, but it was traumatic to you. So what's traumatic to you is actually traumatic to you. There is no justifying it. There is no saying, but abdi edu nadakalaye. None of that, right? We have to address it, address the mother at the place she's at, and take it from there. Life transitions, definitely there's a huge transition now, the birth of a baby, right, which is a huge transition. So that in itself is a huge transition. Quality of perinatal care, right? When I say quality of perinatal care, I'm not just talking about doctors, lactation consultants, doulas, right? Now we are privileged to be in a wider community of professionals, for example nutritionists, body work experts, right? Psychologists, physiotherapists, chiropractic care, infant support, infant massage. There are so many people who are there to support the mother. But are we all communicating with each other when we are supporting the mother? Are we talking to one another? Are we providing a collaborative care is what matters, because that's where we lack right now. There is no communication between the gynecologist and the lactation consultant to begin with. Then comes the role of the gynecologist. The gynecologist and pediatrician probably they do if they're in the same hospital, right? The physiotherapist and the lactation consultant. All of these professionals, we cannot work as independent factors. We have to work together as a community to support the mother in a holistic manner. So, just a little brief of the different perinatal. There are a lot more. These are the predominant ones I'm going to talk about because these are the predominant ones I see in my mothers, right? When I say mothers, please don't get confused. I don't mean my mother, I mean my clients. I call them my mothers because I don't believe in calling them as patients, because pregnant women are not sick people. They are going through a natural process. So, my mothers, when I say my mothers, I mean my clients who I work with, right? Baby blues, we all know baby blues are common, but yes, we need to educate the mother about baby blues for them to know that it's a normal part of their body. It's something which normally happens with them when the hormones are dropping after childbirth, right? The elevated levels of estrogen and progesterone drop suddenly once the placenta detaches from the body, and baby blues are common the first few days after birth. Next comes to postpartum depression, which I'm going to be talking a lot about today. And next, we also come into PTSD, post traumatic stress disorder. And when I talk about post traumatic stress disorder, I'm going to be talking more about the trauma of birth. Since we are in the context of perinatal clients, we are going to be talking more about the trauma of birth. And last but not the least is perinatal psychosis, which I will not be dealing much about today, because first is the time. Next, it is something which needs a more elaborative study, right? It's something we have to discuss more in detail. I'm not going to be able to do justice to it today. So let's begin with postpartum depression, a broader analysis of this. How do we identify the signs, symptoms of postpartum depression, right? So when I began today, I told something about, I think I'm still in postpartum, right? This is a comment I just passed. The reason I passed this comment is because yes, I'm sorry. So, when we talk about postpartum depression, let's begin with the essence of postpartum depression, right? So, I told you a line in the beginning: once in postpartum, always in postpartum. What does that mean? See, when we talk about breastfeeding, right, we say that the WHO recommendation is that you breastfeed at least for 2 years. So when we're telling the mother breastfeed at least for 2 years, how do we expect postpartum to end in 1 year? That's not going to happen, right? Because as long as you're breastfeeding, there are going to be fluctuations in your hormones. There are going to be mood swings. There are going to be fluctuations in all of this. So we cannot expect postpartum to magically be over at the end of year one. Right? That is something we need to know. That is something we need to make our mothers also aware of. So when moms go through, episodes of feeling sad, feeling hopeless, I feel like I'm not doing enough for my child, not taking care of my child enough. I'm having intense emotional reactions, right? This is a very, very common sign of postpartum depression. Having this over a prolonged period of time, right? See, I'm going to be talking about it more from the perspective of the mother than the clinical perspective, because I've had the privilege of having a support group for postpartum moms. I have over 300 mothers in the group, and I will talk to you later on about the purpose of that group. But the whole reason of having this discussion is to understand it from the perspective of the mothers, right? Not the clinical definitions, to understand it in a way that, not as a professional as to what I see, right? I can tell you what I see. I can tell you that, oh, this is how the mother appears, or this is how she's talking. But I'm going to tell it to you more in the perspective of how is she feeling? What is she going through right now? Right? Loss of interest or pleasure. This is something which is very, very common. I have moms telling me all the time that, Aisha, I don't feel interested in doing anything. I don't want to go out. I don't want to do anything. Right? This is something I hear mothers who keep saying this to me all the time, and they think something is wrong with them. I'm very, very glad that Smita brought up this topic about normalizing these things. It's not about telling the mother you have postpartum depression. It's about telling her if you're feeling like you don't have interest in doing things, it is common. All of us go through it. Sometimes all the mother wants is to be heard and her emotions to be validated and for her to be made to feel that you're not alone in this. When you give her these three things, she has the courage, the resilience, and the confidence to brush through and to power through everything. Right? Making a mother feel heard, making a mother feel that her emotions are valid and it is normal. Right? It's the most beautiful part of supporting mothers in postpartum. So I'm going to give you a small example. I'm a postpartum counselor, I'm a lactation consultant. I knew all of this information. Do you think this helped me in my postpartum journey? It did not, right? It did not help me in my postpartum journey. I'll tell you why. Knowing it and feeling it are different aspects of it. So when we are talking to our clients, we know it. We have to feel it with them. If you don't feel it with them, you will not be able to bring them out of it, right? So postpartum depression, having symptoms of loss of interest, changes in appetite. Either you want to eat too much or you don't want to eat at all. Right? The fluctuation in terms of interest. See, that is also connected with breastfeeding. Breastfeeding mothers tend to feel more hungry, especially in the first 6 months after postpartum. So we cannot generalize, we cannot isolate that symptom separately, but that symptom sign combined with other symptoms will give us a clearer picture. Sleep disturbances, definitely. I've seen mums who say that, Aisha, I'm not getting enough sleep. This baby is crying all the time or, feeding all the time. Then when the baby finally goes to sleep, no, they will still not sleep. I'll be like, but why didn't you sleep? You were waiting for them to sleep. Because you go into this rut that this is my only me time. How do I make use of my me time? So very recently, I put a poll up in my social media page, the Mothers Club, and in my WhatsApp group, and I asked the mothers, when the baby sleeps, what do you do? Right? A lot of mothers said, I go to Netflix, I binge on Netflix. A lot of mothers said, I eat snacks which I can't give my child, especially once the child is 6 months plus, when the child is trying to take everything from your hand and eating. Mothers say that, whatever I can't give my child, no, I eat after they go to sleep because I have cravings. I want to binge on some junk food once in a while. Right? I had mothers say that very few of them said I actually do the chores that I have. And yes, there were moms who said that I sleep. Right? But moms who say that I sleep are very, very less because it's a very small window, especially once the baby grows, right? Once the baby goes beyond 6 months, you're probably sleeping only in the night or maybe 1 or 2 naps in the day. So it's a very small window. How much will you fit into that window? Right? So mothers go through a lot of sleep disturbances, and some of them are so used to that pattern. They go into a level of insomnia as well. Definitely fatigue, lack of energy, right? Feeling like I don't have the energy, I don't have the willpower to push through this again. Again, it's important to make the mother know that she has to be taking one day at a time. When you look at the big picture, no, this is something which I've always seen with my breastfeeding clients. Breastfeeding is amazing, guys, right? It is definitely beneficial. Of course, we all need to breastfeed, but it's not easy. It takes a toll on the mother to a great extent because sometimes, for especially working moms who have been so busy all their life, when they start to reflect on the fact that I'm sitting all day breastfeeding, all I do from morning to evening is give my breast to my child. That's all I'm doing. I'm not doing anything else with my life. What's my life become? Is this how my life is going to be in the future? Right? These are very common thoughts. You won't believe if I screen share one WhatsApp One day's group chat of mine, you will see at least one mother who says this: I feel like I'm doing nothing with my life, right? But that point of time, you giving her the courage and the confidence, saying, what you're doing is so much. You feel you're doing nothing, but you're giving so much to your baby. You're giving so much of, you know, valuable health, valuable emotional intelligence, physical intelligence for this child, that nobody else can give that for the child, right? Making that mother feel she's doing so much and giving her that empowerment is what comes with a lot of counseling skills. I'm not from a psychological background, but these counseling skills are something which we have to be able to provide and develop more professionals who can provide it in an evidence based manner, right? Highlight is evidence based manner. Feelings of worthlessness or guilt. This is what I spoke about. Feeling like I'm doing nothing with my time. What am I doing with my time? I'm doing nothing. Right? All I'm doing is at home. I don't work anymore. I'm not able to go out. My friends, people who had a good social life. I'm not able to go for family gatherings. I'm not able to go to social gatherings because, again, the baby will cry. I have to go into breastfeed. Right? So I'm not able to go out. I don't want to go out. Definitely, there's body shaming when it comes to breastfeeding mothers, breastfeeding in public, right? Whether or not you're fully covered is not the problem here. You're still questioned as to why you're feeding in public spaces. That's the kind of scenario where at difficulty concentrating or making decisions, right? We call it mother's brain. Mother's brain, something which happens a lot in postpartum. The mother will feel that she just changed the diaper and then she'll come back again and change the diaper again. You ask her, she'll be like, no, the baby is past motion. But she would have just cleaned it, right? Mom's brain, lack of sleep, lack of taking time for yourself, not being able to take a bath in peace, right? That is constantly, every time the baby cries, there is a panic button which pops up in the mother's brain because she's like, my baby needs me, I have to go, right? Naturally, that is embedded in the mother, but that makes it difficult for her to make decisions. That time we just tell her to relax and ask somebody else be the one to make decisions. We tell the fathers to play a huge role. A lot of the time, the grandmothers, that is the mother's mother, plays a beautiful role in handling this. Withdrawal from family. Many people feel that I don't think my family understands what I'm going through. And if you are the kind of person who you're the first in your friends to have had a baby, I was the first in my friends to have had a baby. I still am the first. I have 2 children and none of my friends have children still. So I always feel that they're not going to understand what I'm saying. Do you think they're going to understand when I say that, oh, I've not slept in days together? They're not. Family sometimes doesn't understand what they're going through, right? So there's a need for the mother to say that I don't want to talk to these people. I don't want to communicate this to these people. I just want to stay away a little bit. Thoughts of self-harm or suicidal ideation is the end of that, right? That is something, if we can prevent the earlier signs and symptoms, if we can notice the earlier signs and symptoms, we can prevent it from going towards the end. We can prevent it from reaching such dangerous extremes, right? So the mother feeling like she's a burden on others, she feeling like, every time I want to do something for myself, I have to be dependent on somebody else, right? Those are thoughts which keep coming to the mother as well. So roughly, these are the strategies we spoke about. These are the signs and symptoms to understand what the mother is going through. Next, before I walk into the support, I'm going to be leaving you with a small thought, right? If these are the signs and symptoms we see in mothers, what can we do? What are we doing is one thing. What can we do is another thing. So what I'm going to cover next might be bridging both. So let's walk through it one by one at a time. And I would say this is the most important slide I want to discuss today. Because the pointers might be simple, but please bear in mind that every single pointer of that plays a huge role in how we impact women as a whole. Support strategies, right? When we say education and awareness, yes, we all know we have to educate. We all know we have to build awareness. But educating whom? Creating awareness to whom and when? Not educating the mother in postpartum about postpartum. Educating the mother in the antenatal stage about how postpartum is going to be like. Educating the community as a whole about what this is going to be like. Why educate the mother only in prenatal? Why can't we educate the mother when she's in college? Why can't we educate women? Why can't we educate girls at their adolescent age? Right? If this is an important phase to go through life, why are we not teaching them about it earlier? Why are we teaching them about it only when she gets pregnant? You know, it is amazing that now we are starting the education system in the antenatal phase, but it can be started much earlier. When a mother is beginning to, think about conception, also we can have these counseling sessions with her, right? And education and awareness should never be an isolated approach. It's always something which should be a collaborative approach. Screening and early intervention. Screening the mothers at an earlier stage, probably when they go in for their antenatal appointments with the gynecs, they can be screened for their mental health as well. They can be screened the level of anxiety the mother is able to cope with. When I talk about this, I want to give you one example from my practice, which is I don't take doula clients who come in the third trimester. I'll tell you why. Because if I don't know the mother for a significant period of time, I cannot support her later on. I won't know how to support her. If I know how she handled her pregnancy, if I can understand how she handled nausea, vomiting, heartburn, or not having sleep, how she's handling stressful situations in pregnancy, it makes me understand how to support her in birth and how to support her in postpartum. If I can understand the mother, how her family is supporting her in pregnancy, I understand better how to support her in birth and postpartum. Right? A lot of the time what happens, family helps you in pregnancy. Family does not help you in postpartum, because after postpartum all the focus is on the baby. குழந்தை தூங்கினானா, குழந்தை சாப்பிட்டானா, குழந்தை வந்து is fine, is he gaining weight fine, is he breastfeeding fine? That's the concern. Are you fine? Are you eating well? Are you getting enough rest? Are you happy? We don't talk about. So that's why I like to know my clients much earlier in pregnancy, and I make it a point. It is not just the classes. I make it a point to talk to them every single week. Every single week we spend at least half an hour to 45 minutes just talking. It's not a great counseling session. It's just talking and catching up with them. You're a friend, I'm a friend. Tell me what's going on with your life. How are you holding up? How's work? How are you balancing it? Are you having difficulties at home? Right? That's all we talk about. But I've realized that mothers who have had this continuity of care with do so well in postpartum. They do so beautifully well in postpartum. The point is not to make them dependent on us always. The point is to give them the confidence to be able to do it even if they can't get people to help them. Right? The point is to educate them so that they know when they need to get help. The point is to give them that amount of information and awareness that they know this is my triggering point. Beyond this triggering point, I need to seek help. Till this is my threshold. I can handle it. Right? That's the amount of education and support we have to be providing. And the screening and early interventions will help us determine that. That's why I spoke about how I would like to be involved with the mother from pregnancy throughout, for me to understand better. Expert-led support groups, right? The earlier, I think one of the last few questions was about support groups. Support groups have been the boon, I would say, for postpartum moms. Because nowadays I'm from a lactation community predominantly. A lot of my lactation professionals, my colleagues, have support groups, and we have all understood how beautifully it helps them. See, it is free support. I'm not denying that it is free support sometimes. But then what are we doing? We've just developed that community. We've just developed that peer support for the mother. But what I mean by expert-led support group is to ensure that it is being monitored, to ensure that it has been guided. So what happens in these support groups is, one mother says, "Oh, I'm not able to sleep. I'm so tired." The other mother says, "Oh, even I couldn't sleep. I just gave him a bottle and went to sleep." Right? When there is no expert to monitor this conversation, the conversation gets shifted based on myths and experiences. We're moving away from evidence-based care. When there's an expert monitoring the conversation, what happens is we guide and nurture the mothers into our evidence-based practices. So this is what we want to provide. So a lot of people have approached me to understand how this expert-led support group works. Right? There is something called Gold Conference, which is a very international platform for all of this, for midwifery, lactation, newborn care, all of that. So the first thing Gold approached me was to ask me, Aisha, what do you do in these support groups? I said, we do nothing. The mothers talk about what's going on. If a mother is sleepless in the night, breastfeeding in the night, she sends a message and says, "Hey, I'm breastfeeding. I'm not able to sleep. I'm very depressed." Right? A support group of mothers is better for her than Google saying what she has to do. Right? So, sorry, somebody has raised their hand.
Hi, ma'am.
Yes,
Sorry to interrupt. Just we have
no
few
problem.
minutes left. Would you able
No
to
problem.
finish the session as early as
Yes, yes.
possible?
I just have 2 more slides.
Thank
Yeah.
you.
Thank
Sorry
you so
for
much for the
interruption.
reminder. Yeah. Right, so these expert-led support groups are so valuable and they're immensely helpful. So this is something we want to encourage. We want to be able to provide that space for mothers to be heard. Definitely individual counselings and therapies are some things you guys are the experts in. You know that. So usually, since I'm not from a psychology background, what I do is when I know there's a need for a mother to have a deeper counseling and therapy session, I refer to psychologists, sometimes to psychiatrists as well, depending on the situation. Access to resources and referrals. So, when I say this, we should have a resource network where we are able to give them evidence based support. Postpartum Support International is a very great community for postpartum support. We should have one like that in India. Right? We should have. There are a lot of them. There are a lot of them which I refer right now. But I'm saying we need something in that scale as well. Collaboration with healthcare providers. I cannot explain the importance of this. If you're going to support women, we should be supporting them as a community. I cannot be saying something different from what the nutritionist is saying or from what the gynecologists are saying. We should be in collaboration with each other so the mother gets the same information from all the support people, right? If I tell the psychologist that this is the problem she's facing at home, and the psychologist says, no, Aisha, that's not what it is. She's actually going through something deeper. We should be able to communicate and, address the differences, right? If we don't address the differences, I don't want my mother getting confused because of our difference of opinions. So having a collaborative approach and continuity of care matters a lot for the mothers. Most importantly, we need to break the stigma of seeking mental health support, right? When you walk in the rain, right, you feel the rain. You don't become the rain. This is something you might feel like, what is this? How is this applicable here? But a mental health disorder does not define you. I hear moms telling me that I don't want anybody in my family to know that I'm going for help. I don't want anybody in my family to know that I'm going to get support now for this particular issue. I was very, very verbal about me seeking mental health support in my postpartum phase, mainly because of this. When I go out there and say, I had postpartum depression, I went to a psychologist, I had counseling sessions, I got through out of it. I'm fine now, right? Let's normalize that. It doesn't define who I am, it doesn't define the care I provide to other mothers, but it makes people understand that this is normal. We have to normalize it. We cannot define them by the disorder. Going to a psychologist cannot be a stigma. Going to a psychiatrist cannot be a stigma, right? We cannot only prioritize physical health and neglect mental health, especially for mothers. The reason I'm saying especially for mothers is when you are going to become a mother or when you become a mother, right? There's this transition phase where already all the spotlights are on you. Everybody wants to give advice to pregnant women and postpartum mothers. Everybody has an opinion to share. When that is the case, no, they will all have an opinion even if you're going to the doctor. They'll say, oh, you're not fit to take care of your baby then. You have some mental problem. You cannot take care of your baby. So let's break that stigma. Let's work towards it as a community together. I'm so glad that we're doing this for psychology students. I hope to see a lot of you come and support mothers. We need so many, right? When we were developing some apps for mother support, we were finding it so hard to find psychologists who had expertise in mental health, in maternal mental health. So I'm really, really privileged to be amongst your midst. And I really hope more of you come out and take the lead, spread the awareness. talk about it more, care for people around you more, spread the awareness, make this normal, right? Addressing a mother's mental needs, emotional needs should be as important as addressing her physical needs. And if we as professionals don't normalize it, who is going to normalize it? So let's normalize it. Thank you all so much. These are my contact details for those of you who want to reach out. The Mothers Club is my Instagram page. Please feel free. I would love to collaborate and do more with you all. Thank you all for this wonderful privilege. I look forward to the wonderful sessions that are going to follow soon. Thank you all so much.
Oh, that is excellent, Aisha. It was so great pleasure listening to you on postpartum. Let's looking forward working with you. This is Shubhasri from the Night Rest.
Thank you so much. Thank you, Subhashri.
Questions came.
Thank you, ma'am. Ma'am, there's one question in the comment section, ma'am. It is,
Yes.
how physically challenged newborns such as blind and deaf impact maternal mental health?
See, when I talk about mental health and the physical challenges, it's not just blind and deaf, right? See, those are. At, let's talk about that first. Definitely, first, when you expect a baby perfect and then suddenly you see there is some defect with the baby. I'm not going to specify the defect also, because there are some defects we understand, there are some defects we don't understand. Right, there are things like cleft palate which mothers didn't even understand. Even if I talk about things like tongue tie, they don't even know what a tongue tie is, let alone be able to support that baby through tongue tie. But definitely that plays a huge role on the mother's emotional stress. It's not just the stress of looking at your baby going through pain and discomfort, it is the stress of handling the family which is going to blame you for it. They are going to have a lot of superstitions revolving around that, saying, oh, நீ வந்து என்னது அம்மாவாசை இன்னைக்கு இது பண்ண, or eclipse போது you went somewhere, that is why something happened to your child, right? They have their own set of superstitions for that. So dealing with that, right, dealing with your own trauma of handling your child, dealing with the insecurity that what is going to happen to my child's future, dealing with the challenges of the medical system of taking your child through treatments, right? That is a huge role, that is a huge thing which is going to so usually what we do is, when we know that that there is some defect in the child, if we know it in the antenatal stage itself, if we know it in the ultrasound itself, we start counseling from there. I'm also a counselor for club feet babies, right? So club feet is a disorder. For those of you who don't know, club feet is a disorder where the feet are turned inwards. My child had club feet. So ever since that, I've started advocating for supporting mums who deal with club feet babies, right? The reason being, when we know this in the ultrasound itself, it's easier to prepare the mother. So we start counseling from then, saying when the baby is born, you might feel like this. When you see your baby every time, you might feel like this. So we power her through from antenatal. We equip her. As she's going to the gynecologist, she also keeps coming to us for counseling, right? We keep supporting her with evidence-based information. So whatever the defect is, if it's a defect which can be cured, we educate her about the cure as well, right? We refer experts who can speak to her. We connect her with professionals. We connect her with doctors, connect her with pediatricians who can speak to her and give her the right information about it, so that she's not clouded by misconceptions. Educating her is one. The next aspect comes is counseling her emotions, right? And allowing her to feel what she's feeling, not shunning her emotions, validating her emotions, making the family understand that, I know you are also worried about it, but then you have to take care of the mother also, because her worry and her stress affects herself as well as the child. Right? The father's stress is may not going to necessarily affect the child, but the mother's stress will definitely affect the child. So education, counseling at as early as possible. If it is something which cannot be cured, if it is a disability which cannot be cured, we have to find the right support groups. We have to find the right support groups for her to be able to share and converse with other mothers who are going through this. So for club feet mothers, it is something which can be cured. but the treatment takes a toll on the mother. So we have a club feet mom support group. So like that for specific disorders. So I do for the ones I have knowledge of. I'm sure there are ones which others have support groups for. So definitely having that support group with those experts is a huge step. Awareness, education, cannot tell that enough. And let's normalize it. Let's normalize the way the mothers feel.
Thank you, ma'am, for compassionately answering, and thank you for illuminating us with your knowledge, ma'am. Tonight platform as a YouTube, and the link has been posted in the comment section and also in the WhatsApp conference group. For more information, kindly check on the link and check for yourselves. Thank you everyone for your active participation. Participants are requested to stay in the same link for the next session. Thank you.
Good morning. Swati ma'am, are you ready to start the session?
Yeah, you're ready.
All right, ma'am. A very good afternoon to all gathered here. We will now be moving on to the second session of the International Conference on Prevalence and Importance of Maternal Mental Health. I'm author of third BSc Psychology, and it gives me immense pleasure and honor to welcome our distinguished guest, Mrs. Swati Jagdish, whose journey in the realms of psychology, lactation counseling, sex education, and social media influence has been nothing short of inspiring. Mrs. Swati's story is one of passion, dedication, and unwavering commitment to making a positive impact on the lives of others. She has cultivated a thriving community of over 4 lakh members on her social media, where she addresses a wide range of topics, including children's safety, parenting, lactation, mental health, adult intimacy, and women's issues. Through her platform, she has become a beacon of support and knowledge for countless parents and caregivers seeking guidance in navigating the complexities of raising a family in today's world. Mrs. Swati's journey took a significant turn following the birth of a child at one of India's leading birth centers, Birth Village, Cochin. This profound experience not only transformed her life, but also sparked a deep-seated desire to address the lack of information surrounding lactation, informed birthing, and parenting among young Indian parents. This realization led to the establishment of the Coimbatore Parenting Network, CPN, a public charitable trust that has since grown to over 20,000 members. Through CPN, her and her team worked tirelessly to organize breastfeeding awareness campaigns, breast milk donation drives, workshops, and conferences aimed at promoting gentle parenting, national birthing, menstrual health, and sex education. Today, she continues to inspire through her online and offline classes on age-appropriate comprehensive sex education, as well as her candid discussions on adult sexuality and relationships. Through the Instagram platform, she has created a community of like-minded individuals dedicated to personal growth and societal change. We're honored to have her present with us today, and I invite you all to join me in extending a warm welcome to Mrs. Swati as she shares her insights and experience with us. Welcome, ma'am.
Thank you so much. I can start now?
Yes, ma'am.
Am I very clear?
Yes, ma'am. We can hear you.
Because there's a fan in the background. If I'm not clear, I'll switch it off. That's all.
You're clear, ma'am.
Okay, cool. Yeah, so before we begin, I'd like to know who the audience is. Do we have only psychology students and professionals or other professionals as well? I mean, other departments or other people who are in other fields?
Most of them are only from psychology.
Oh, cool. Okay, that's nice. Yeah, because it's very rare to find a college level discussion on postpartum, because postpartum is a very ignored field up until recently, when conversations have started off via social media, via support groups. Until then, I don't think there was much conversation about postpartum anywhere. So I'm very happy that Department of Psychology has taken the initiative for this. Let me see if you can see my screen. 1 second. Not so used to Google Meet. 1 second. Okay. Can you see the screen?
Yes, ma'am.
Yeah, okay. Yeah, so I have titled today's session as Postpartum 3, because we're going to mainly talk about 3 points today. You can see me and the screen in the same screen, or just the screen?
The screen is, we can see both of you.
You can see both. Okay,
Yes, ma'am.
then it's okay. Yeah. So today I have taken 3 points to discuss with all of you. We have, I think, an hour to discuss. Because postpartum is a topic that I can really go deep, and then I can talk about it for maybe 3 days. But I've taken 3 points so that it will be easy and understandable to all of you. Personally speaking, I don't think before postpartum a woman will be even interested in postpartum. If you had asked me to attend a postpartum based workshop or seminar, I don't think I would have attended because it's a field of study that you will be interested in when you're going through that phase, actually. But I'm glad if some of you are interested to learn about it, because it's very rare. I would not have been interested, to be very honest with you, because if I was a college student, I'm just thinking, I'm a college student, 19, 20, or maybe 18, or even maybe PG or PhD student, 22, 21. Still, I don't think I'll be interested in understanding what all will happen during postpartum, because I have not really gone through it, right? So to even know that you people, some of you at least, are interested to know about it, is it's a good thing. Yeah, interesting, very interesting. So as I told you, it's not a very fun, amazing, awesome stage or anything. It's a very mixed feeling that I get when I think of postpartum. So on one hand, yes, you have the baby with you. You are a new mom, or maybe a second time mom or third time mom, whatever it is. Each time a person gives birth, they feel like a new mom, actually. You have the baby. You have to take care of the baby. The baby is very dependent on you for food. And you yourself is in a very, very vulnerable stage, in the sense, your body has just gone through a long, tedious process of giving birth, which is a very exhausting process. It's almost like running a marathon. So you're very tired, you're frustrated, you're exhausted. You don't look like before. So there is no more the pregnancy glow, the joyfulness of anticipating the baby's arrival. That and all is gone. Now the baby is out. Everybody's focus has turned towards the baby suddenly. So most postpartum mothers feel very ignored, isolated, lonely. So one hand you have this baby, you're supposed to be happy. On the other hand, you have so many things going on around you, in your body, in your environment, in your family. So you're kind of stuck between the both. And that is exactly why postpartum is exactly like adolescence. We call this phase matrescence. Just like adolescence, it's a phase of life that this woman is going through. So like adolescence is in between 13 and 19, and this child doesn't feel like a child anymore. Also, the child is not an adult fully, somewhere in the middle, right? So that is the kind of stage that is postpartum. It's called matrescence, just like adolescence. Um, and there are three things that I would like to talk about today, as I told you before, which I want all of you to start reading and researching, even if you're not mothers. Some amount of knowledge will always help you tomorrow if any of you decide to become lactation consultants or postpartum specialized maternal mental health counselors, because we are in huge need for that. There is a huge void in that space. Even when my clients go to psychologists, psychotherapists, they always say, ma'am, no one understands us like you. Which I've taken as a big compliment, because there are certain elements that are not there in psychology curriculum, which a maternal mental health counselor needs to know. So, two of which will be part of my 3 points. The third one, you all will anyway learn more about when you learn more about postpartum. So, 2 points are not really part of psychology curriculum, but a psychologist or psychotherapist or any social worker, anybody who deals with postpartum needs to know. Okay. So let's start with point number 1. What impacts postpartum? So 3 things I'm going to talk about. 1 is birthing. 2 is lactation. 3 is general postpartum changes and postpartum environment. Okay. So we'll start with 1, which is birth. Okay. Now, some of you here might be okay with the concept of birth or birthing, childbirth, but I'm sure many of you are scared of it, right? You're scared of what's going to happen, because whatever we have seen in popular media is very scary. We have seen water break as a huge, big catastrophe. We have seen women yelling and screaming, and maybe an ambulance coming to take her away. We have seen this woman being taken into the hospital in a stretcher or a wheelchair. She's screaming, yelling, holding her husband's hands frantically, scared of life. And she's wheeled into this operation theater. We would have seen all 90s movies, early 2000s movies, where they show this operation theater with a red light in front. And then doctors and nurses coming in and out, not talking anything to the family about what's going on inside. And the husband and the family members walking hither, thither, here and there, not knowing what's happening, waiting with bated breath. And finally, somebody coming from inside, handing over the baby to the husband and the family, telling it's a girl or a boy. Or maybe even in worse circumstances, telling we couldn't save the mother or we couldn't save the baby. So this is the kind of image that we have in our head when it comes to birth. But is that really the true picture? I don't know how many of you have been curious enough to explore birthing videos, because there's plenty of birthing videos available online, especially on social media, on Instagram. There are so many pages that are dedicated to birth videos, like Badass Mother Birther. You can go search for that page later on, which posts a lot of videos on natural birth, water birth, hospital birth also, all kinds of birth, just to give people a flavor of what they can expect in birthing. And most of those videos are not scary, to be very honest. My daughter, she is 9 years old. She has been watching birth videos from the time she was 6.5, 7. She's not scared of birth at all. In fact, she's looking forward to it. She sometimes says she needs 7 children. Sometimes it goes to 4, then back to 7, then back to 4. Or nothing less than 4. Huh? She's looking forward to giving birth. It's a beautiful experience, according to her, that she is waiting to go through. Unfortunately, that is not the kind of experience that majority of women go through in our country. There are many reasons for that. I can probably state 1 or 2 reasons to you, because this is not a birth-related class. because I can talk about this topic for maybe 4 hours, non-stop. There's such a lot of information. But the sad thing is, when it comes to childbirth, women are going through very bad experiences, traumatic experiences, sad experiences, lots of regret, lots of guilt, lots of I should have done this that way, this should not have happened, that should not have happened. Maybe if I had prepared for this, I would have had a better outcome, better experience. Maybe if my husband was with me, it would have been like this, it would have been like that. Maybe I forgot to ask the right questions. Maybe I should have said no at the right time. I didn't have body boundaries. People violated my consent. People violated my boundaries. Lot of bad experiences, sad experiences women share. Now, before going into the bad experience part, let me just tell you how an ideal birth, not even ideal, what is supposed to happen in birth. So first of all, imagine a woman fully pregnant, about to give birth, 9 months, 9.5 months, or close to 10 months. She is about to expect labor anytime. Yeah. What all is supposed to happen? So I'll very quickly, in very short way, I'll just explain to you. So she's ready to give birth. So the message to her body that I am ready is given by the baby. Baby only tells the mother, I'm ready. Now I'm talking about a general, normal, natural birth. Okay. No intervention, nothing. Naturally, what will happen or what is supposed to happen. I'm not talking about a preterm delivery where the baby is sick and the baby is deciding to come early. No. I'm talking about a normal term birth. 39 weeks or 40 weeks or 41 weeks, whatever it is. So this baby is giving the message to the mother that I'm ready. Mother's body is getting prepared for labor. When the baby says it's ready, the mother's body secretes a lot of oxytocin. Oxytocin is secreted in large amounts when the mother is ready. Sorry, when the baby is ready. One second, I stopped sharing. Okay, yeah. So the baby is ready. Mother's body secretes a lot of oxytocin, and that's the time when the mother's body secretes oxytocin in very large quantities. Oxytocin is a very shy neurochemical. It is secreted. It's a hormone also. It's secreted under very, very rare circumstances. You know, when you're breastfeeding, when you're in love, when you're in labor, when you're experiencing an orgasm. So it's secreted in very, very rare circumstances. It doesn't come out all the time. So birth is a time in which oxytocin is secreted in large quantities. And oxytocin's job is to calm down the body and make the body feel very relaxed and nice, okay, ready for labor. And this oxytocin goes and gives message to the pituitary gland to secrete a lot of endorphins. And endorphins, one of the jobs of endorphins is to manage pain. And endorphins completely take care of the pain. And that's why if it's a natural labor, the mother's, doing this and swaying and moving around and walking. She's handling labor herself. Then what happens? The mother's body goes into this dance, I would say, natural dance in which she allows the baby to come out. And the baby also does a lot of work. So childbirth is not just a mother's job, it's a baby's job also. Baby also does a lot of hard work to come out. Considering it's a very nice position in which the baby can come out very comfortably, nothing bad happens, no complications. Mother's probably squatting and she's in she's on her 4 legs, or she is sitting on a birth stool, or she is hanging on a rope. That's what I did during my labor. So I was given a rope and I had to hold the rope and I had to squat down and I had to give birth. And the midwife was just catching the baby from underneath. My husband was holding me from behind. So whatever is the position that the mother's body asks her to be in, she is in that position and the baby comes out. Once the baby is out, you wait for a bit, and then nutrition was going to the baby through placenta. Placenta also has to come out now. So slowly after that, there's a second birth. So there's not just one birth, there's 2 births happening. Placenta also is birthed behind the baby. It just slips out actually, comes out. Now when the placenta is out, the body gets a message, oh, baby's food source is over. Now we have to arrange another food source, which is the breast. So the message goes to the breast to be, okay, you guys ready with the colostrum? Let's give that to the baby. And the baby is out. The baby is put on the mother's chest. It's called the golden hour. Baby is on the mother's chest for close to an hour. And the baby is allowed to do something called breast crawling, where the baby just crawls. Can't see, so it'll just smell, because the sense of smell is very high for the baby. So they smell, and they find the breast and they latch on and they drink. This is what all mammals do. But when a human baby does that on a mother's chest, it's beautiful to watch. It's very magical to watch. I want all of you to go watch birthing videos and breast crawling videos, where you'll find how amazingly nature has orchestrated this whole event of childbirth. I'm getting goosebumps while I describe this, actually. So the baby breastfeeds and the mother's fine, the baby's fine, the mother's allowed a little time to recuperate and, heal and all that. The baby is taken care by somebody while the mother is washed, given a bath, and then the baby comes back to the mother. The baby stays with the mother all the time, skin to skin, yeah? So the baby doesn't feel that the mother is gone. He's there with the mother all the time, skin to skin, sleeping by the mother, on the mother, breastfeeding, then sleeps, then come back, then poos, pees, sleeps, come back. So that's what happens in the first 2-3 weeks. It's almost like back to back feeding. So the mother has to be given that time with the baby to bond and to get to know each other and to know each other's patterns. Oh, the baby is going to sleep during this time, or maybe I'll take a bath during that time, or maybe I'll catch a little nap during this time, because I'm sure from 11 to 11:30 the baby is definitely going to sleep. So you get that patterns and you know what each other's habits and all are. Slowly it's forming. So first 2-3 weeks are like that. Entire family needs to support the mother during that process, helping with the baby, helping with the mother. And then slowly what will happen? Slowly they'll create this nice harmonious rhythm in which they know what time, what will happen, how to clean the diaper, the poop, the pee, how to try different positions during breastfeeding. Oh, this is not comfortable for me. Let me do that. Things like that. So this is how ideally it's all supposed to go. Now this ideal scenario. On the other hand, what happens is, in most cases, today in institutionalized births, what we see is, in most cases, mothers are not allowed to go into labor by herself. By the time she's 37, 38 or maximum 39 weeks, she's asked to come and get admitted for some reason. Okay. And in many cases, that reason is an unnecessary reason. There is a book that you can read. It's called Creating Your Birth Plan. It's written by an obstetrician, Dr. Marston Wagner. He talks, an entire chapter is dealing with unnecessary reasons for inducing a mother. Unnecessary reasons. And if you go through the reasons, many of your clients will tell you those reasons. After talking to more than, I would confidently say more than 8,000 mothers, personally, one-on-one, during my lactation practice, most of them have given me, not everybody, most of them have given me one of the reasons that could have been easily prevented. One of the unnecessary reasons. Ma'am, I was asked to come and get admitted because of so and so, my fluids were less. But there are ways to increase fluids. Why is that not taught? The place where I went to birth, there are ways to increase fluids. Sometimes that can be done. Not in all cases, but something can be done to prolong that time in which baby can be with the mother, as much as with the mother. Because studies say that as much as time with the mother is best for the baby's development. But in most cases, that doesn't happen. Baby is somehow taken out. Okay, you come and get admitted, let's bring you out. Let's say the baby was planning to come out at 41 weeks, 2 days. And the baby is taken out at 37 weeks, 4 days. Imagine the stress. Imagine the stress of the mother's body, stress in the baby. So what happens is, when it's not the ideal scenario and the mother is in a hospital environment, or wherever she is taken to, where she is not ready, her body is not ready, baby is not ready, lots of lights and sounds around, lots of beeping, lots of machines, lot of connections, IV line, this, that, electronic fetal monitor is going on, this, that. So many things are connected. So many people are around me. And I'm naked, I'm butt naked in front of 8-9 people whom I haven't seen until now. Last 9 months, I've been seeing one particular doctor. That doctor is nowhere to be seen. Other assistants, other nurses, everybody's around me asking me to do this, do that. I'm lying down on the bed, unable to change positions. I want to just sit up for some time. I want to do this. I want to squat. I want to stretch out for a bit. I want to stand under the shower, make my body a little cool, or make my body feel a little warm. I want to hear some music. I want to eat something. I want to drink something. Nothing is allowed. Nothing is there in protocol. So our best practice is followed, I'm not very sure in many places. So imagine in this kind of scenario, I'm super vulnerable, I'm naked, butt naked in front of 8-9 people, I am going into stress. And most of your psychology students, I don't have to explain it further, right? What is your nervous system doing? It's in sympathetic mode. Your nervous system is completely in sympathetic mode. And what is happening? So you're in the sympathetic mode, and then you're really stressed and you're tense, you don't know what is happening. You go into the fight or flight. Go into the fight or flight, or worst case scenario, freeze. You're like, okay, fine, just do something and bring the baby out. I'm scared, I'm super scared. So will oxytocin be secreted during that time? Will the mother feel, nice, I just have to do this, do that, and my baby's going to come out after some time? No. Will endorphin be secreted? No. Along with everything, if artificial oxytocin is given, if pitocin is given, then gone. One intervention can lead to a cascade of interventions. Studies are there for all these things. Whatever I'm saying, there are studies, there are evidence. I've read through all these things. Yeah, it's not my field. Yeah, I'm not a childbirth educator. Yeah, I'm not a midwife. I'm not a gynec. But I've read through all these things. Why? Because I want to understand what this client has gone through. Okay, I had a nice experience, natural experience. That doesn't mean I shouldn't be able to understand a hospital-based experience, what a person has gone through in a corporate hospital or somewhere where she was not given a nice experience, right? I need to know that story, that side. So her body gets into fight, flight, freeze. And then what happens? Her body is filled with adrenaline and cortisol. Instead of oxytocin and endorphin, her body is filled with adrenaline and cortisol. Do you think that's the ideal scenario for a baby to come out? Do you think that's the ideal scenario for the mother to birth? So from that time itself, her body is in stress, and sometimes it's registered as trauma. And that we call as a birth trauma in the mother, birth trauma in the mother.
Excuse me, ma'am.
Yeah. Yes?
Could you present the slides?
Slide is there on screen?
In full screen, ma'am, from like the current show. Like, just present the entire screen. Yes, ma'am. In the beginning, it's written like from current slideshow. Can you like?
What can you see on screen now? Can you see the autonomic nervous system?
No, ma'am. Looking at birth.
Oh, okay. 1 second. Because I thought I'm sharing the nervous system. 1 second. Can you see now?
Ma'am, you haven't shared your screen yet.
Is it the autonomic nervous system that you can see?
No, ma'am. I'm not seeing anything as of now.
Also, from the beginning, you have to share. Only then you'll see that slide. Okay, now can you see?
No, ma'am, you stopped sharing your screen like completely.
Oh, okay. Yes, I'm not so used to Google Meet. 1 second. Now can you see?
Yes, ma'am. I can see the first slide of postpartum 3. I can see the first slide, ma'am.
You can see the first slide only?
Yes, ma'am.
Okay, I'm showing the second slide now. Can you see the second slide? No?
No, ma'am. It's the first slide.
Oh, you've been seeing first slide all this while?
Yes, ma'am.
I shared some 4-5 slides.
Okay, ma'am.
Oh, I don't know what to do. 1 second.
Oh, I can see the second slide now.
Okay, you know what? I'm going to share like this.
I can see the second slide now, ma'am.
Yeah, now you can see the third slide?
Yes, ma'am.
Okay, I'll share it like this then. This is better, no?
Yes, ma'am.
Okay, so this is what these are the 3 things I'm talking about.
Okay.
And we're talking about birth now. We're talking about sympathetic system riding. Can you see the sympathetic, parasympathetic on screen?
Yes, ma'am.
Okay, cool. Then I'll share it like this itself.
Okay, ma'am.
Yeah. Yes, so what we are seeing is in most of these mothers, when they go through some kind of birth trauma because of induced births for unnecessary reasons, or something happening during the labor, which her body registered as trauma. Something, it can be consent violation, it can be body boundary violation, it can be somebody questioning her, somebody being rude with her, somebody screaming at her, somebody asking her to keep quiet, her not being able to be with her partner during labor, which she really anticipated, which she wanted, or it can be an emergency C-section, which she never expected, or it can be an episiotomy stitch. I don't know if you girls are aware of it, but there are a lot of medical interventions that happen which we need to be aware of. So episiotomy stitches can sometimes cause a bigger trauma than even childbirth. A lot of mothers have told me, ma'am, childbirth I could handle. This episiotomy I could not handle. So this is what episiotomy looks like. So they make a cut on the perineum, to facilitate a vaginal birth, which shouldn't be done in all cases, but unfortunately, in most Indian hospitals, it's done as a routine procedure, which should not be the case. That's not what evidence suggests. Evidence suggests it has to be done on a case-to-case scenario. Unfortunately, most people have 100% episiotomy rates. So that's not supposed to happen, right? Imagine the pelvic floor of these mothers. No doubt their pelvic floor is weak. No doubt they're losing interest in sex. So one thing leads to another, and we are damaging these mothers because the system is made like that. So slowly, one after the other, we need to change the system, because everybody cannot run for natural birth. Everybody cannot run to a birth center. Everybody cannot have a water birth. Very rarely, few people are able to afford it or able to make that kind of a decision, who have such strong boundaries with their family, might be able to do it. What about the larger section of the crowd? What about them? We need to give everybody a good experience, right? And in many cases, I've also seen the C-sections are not what gives trauma. Many mothers are very happy with C-sections because they expect C-sections, because of some medical background or some history or something. They would have had a risky pregnancy, something. I have seen a lot of mothers who have trauma after vaginal births because of an episiotomy in many cases, or because they were screamed at, yelled at, because they were not allowed to move and their body went into freeze mode. It's not C-sections that cause trauma in many cases. Yes, we need to learn about birth also. We need to learn about what happens during childbirth. We need to learn about birthing interventions, what happens in institutions, what can affect a mother, what can affect a baby. And one part of it is birth trauma can affect the baby also. Imagine a baby that's entering into the world with stress, with trauma. It's being pulled out of the mother's body when it needed some time to come out, needed the whole process to be gentle, whereas it's hurried into the world. Maybe that's why we're all in a hurry mode, maybe. Hustle. And imagine babies being separated from the mother. Perfectly normal, healthy babies being separated from the mother after birth. For some reason. Taken to give a bath. Why? What does it need to give a bath immediately? Where are they going? Going to office? No skin to skin, no kangaroo care, no immediate breastfeeding happening, formula being given before breastfeeding. We're getting into that zone. We're getting into the zone of breastfeeding, what all babies go through. So babies can also come up with birth trauma. I get a lot of my lactation clients coming up with babies with fight, flight, freeze. Baby is in the fight, flight, freeze mode, It's too much of crying, too much of, they call it colic, they call it being gassy, they call it this, they call it that. But underlying is a very simple theory. The baby's body is in a sympathetic mode. That's the underlying fact. Oh, this is that, that is this. You can just label it and send the mother away. Oh, give some Colicate, the baby will be fine. No, that's putting a bandage over the problem. In many cases, a lot of my clients' babies have needed body work, have needed trauma release to bring them back to a parasympathetic mode. So mothers, babies, both of them are struggling. So that brings us to breastfeeding or lactation issues where, either it's because the baby is separated from the mother after birth and the baby couldn't initiate breastfeeding properly, or the baby wasn't given a chance to breast crawl, or maybe the baby was given formula before breastfeeding was initiated. Maybe there was no lactation consultant to assure the mother that, no, there is colostrum, don't worry. Because so many people don't realize, that the baby's stomach after birth is the size of a cherry. To become the size of an egg, it will take a month. So how much colostrum do you think a mother will need immediately? Very, very little. The baby is fine with very little. The baby only wants to suck, because when the baby sucks, there is peristaltic movement inside and the baby's poop. The meconium will be pushed out. That's what the baby needs to do, more than drink liters and liters of milk. Whereas, is that sucking allowed? I've seen when I was working at a super specialty hospital, I've seen in many cases when the baby is sucking on the mother's breast, you latch the baby on, and the baby is beautifully latched, the mother is fine, everything is okay. But the baby, the moment it starts spending more than 20, 30 minutes on the mother's breast, the people around, the grandmother or the aunt or somebody else are like, why is the baby always on the mother's breast? Let's take the baby away and let's put the baby. So they want to separate the baby from the mother. There is no bad intention. They think, oh, baby is getting too attached to the mother. That is triggering them a lot. So there's a lot of layers underneath, What are the people around? What do they know? What do they believe in? What is the knowledge they have? How long did they breastfeed? A lot of people in the immediate family, if you check, no, they haven't breastfed for a long time. We think they are all experts. No, that's not the case. So because of some reason, the baby's breastfeeding is not initiated properly, or the baby could not latch on because of some reason, because of a high arched palate, or because of a tight jaw, because of a tongue tie or something. And nobody noticed these things. Or maybe the baby was just having a fight, flight, freeze response, and the baby's jaw is very tight and it's not able to take a deep latch, and it was sliding down to the nipple, it was biting all the time, and the mother couldn't continue feeding. The mother ended up with blisters or chapped nipples, that, something can happen during breastfeeding. Something. And if the breastfeeding journey comes to an end, and if formula takes over, or maybe, what will happen? The formula comes and the breastfeeding has come to an end. That also has happened in many cases. Nipple confusion, introducing bottle or nipple shield before the breast. So many things can go off during lactation. And that's what introduced me to this whole world of postpartum struggles when I studied lactation. Because I didn't have a lot of breastfeeding problems, personally. So what happens when the mother is unable to continue breastfeeding and she ends up with a bottle or with a formula, or she ends up with a very difficult breastfeeding journey? I know mothers who have breastfed for 1 year with pain because people told them pain is normal. No, pain is not okay. Pain is a signal that the body is giving you that something is off. Pain is okay if it has an end. Let's say period pain. It is going to end in 2 days. Good. Childbirth pain. Oh, it's going to end in 2 days, and it's a process through which the baby comes out. That pain is okay. It's fine. But non-stop pain, no. It's a sign that something is off. So without enough support, a lot of mothers' journeys come to an end very, very early. She's not able to continue. And what happens? She ends up giving bottle or formula. And you know what she goes through? She goes through breastfeeding grief. It's grief that she goes through. Oh my God, such a normal, natural thing I'm not able to do. What am I even doing? What kind of a mother am I? And imagine if this woman has gone through C-section also. She's having double grief. Oh, natural, normal thing of giving birth, I was not able to do. My body failed me. Again, breastfeeding also, I'm not able to do. My body failed me. She is going through hell, I swear. She's going through a very difficult time. And all that she hears from around is, it's okay, it's fine, it's okay, just chill, you've got a healthy baby. You've got a healthy baby, but you've got a damaged mother. So healthy baby is not the solution. We have to take care of these mothers. We have to handle their issues. We have to give them some solutions. We have to support them. So breastfeeding grief is a huge problem during postpartum. That has made mothers go through postpartum depression. We always say postpartum depression. Oh, postpartum depression is because of some hormones going haywire. No. Why are the hormones going haywire? Because the body is in fight, flight, freeze. Body is in survival mode. A lot of these mothers, they carry over that grief and that anger and that trauma into their parenting journey, and they are not able to give solids in the right way. When I take classes for baby-led weaning or giving solids, they're like, no, ma'am, I'm very particular about how much the baby eats. I'm very particular about, how much weight the baby gains. My pediatrician is okay, everybody is fine, but I'm not comfortable. I'm not convinced. Because that is an area where she can exert a lot of control, because she lost control during birth, she lost control during breastfeeding. This is the only area where she can give some control. So she's trying distraction feeding or, force feeding, or she's too obsessed with the babies, with the child's eating habits. I've seen not thousands, I would say lakhs of mothers like that. And many of them, they want to follow gentle parenting. They attend gentle parenting classes, they read parenting books, but they're not able to follow because their body is in survival mode. How can they be gentle? They're angry every time they see the child throwing a tantrum or breaking something or falling down. They're like, ah! But then later they feel guilt. They feel a lot of regret. They cry. After hitting the child, they sit and cry. Ma'am, I don't want to do it, ma'am. I know it's not okay. But I don't know what else to do. And the third thing that I want to share with you is other kinds of postpartum changes and her environment. So what are some of the other kinds of changes that she goes through? Body changes, stretch marks, saggy skin, looking pregnant even 4-5 months after childbirth, because it takes time for the stomach to go in. But for the family members, immediately it has to go in. Yeah, suddenly everybody is interested only in the baby. Nobody's interested in me. Hair fall, postpartum hair fall. It's all normal. She needs somebody to tell her it's okay, it's normal. Body is looking completely different. Lack of self-esteem takes a huge blow. Self-esteem takes a huge blow. I hate myself. When do I go for work? When will I resume a career? Baby is there, expecting 100% involvement from the mother, but the mother's mind is in her work, in her job, in her career. She doesn't know what to do. There are a lot of unanswered questions. And every single day the baby does something or something happens which gives her some question, like, why is my baby making the sound? Is it normal? Is it okay? Is it okay for my baby to poop in yellow color? Today it's brown? Today is slightly blackish? Today it's greenish? What do I do? My baby vomited. My baby is doing this. I don't know what to do. Yeah, so immediate changes as well as the environment, support of the husband mainly, support of the husband. How much is the husband, the partner supporting her? It's okay, we'll manage. In many cases, husbands also end up with postpartum depression. They don't know what to do. They don't know how to handle the mother. They don't know how to handle a baby. They don't know. Everybody is telling this person is telling this, that person is telling that. I don't know what to do. In many of my classes, I've actually answered most of the husband's questions than the wife's questions. Yeah, because sometimes he will be in the middle of his mother and the wife. My mother is telling do this, give solids at 3 months. My wife is telling I'll give solids only after 6 months. What do I do? Because they also don't have any boundaries, with family members. Men also don't have boundaries. We think they have amazing boundaries, but no. They're struggling. They're struggling a lot. And then comes the immediate family. The girl's mother, father, the boy's mother, father, aunts, neighbors. What are they saying? Are they forcing the mother to give formula? Are they, body shaming the baby, telling the baby is too slim and too thin and too weak? Are they body shaming the mother? You still look pregnant. You look horrible. Yeah, so their support. And more than anything, peer support. Support of other mothers who are going through the same journey. That is what a lot of mothers actually lack during postpartum. Yeah, so we in Coimbatore, we had a mother-to-mother support group. When my baby was around 4 months old, a couple of us initiated that kind of a support group, and we had regular meetups happening. So these are some images from our support group meeting. It started off as a WhatsApp group. Now it's a huge group, and we have registered it as an NGO. It's called Coimbatore Parenting Network. We've been doing a lot of awareness activities and campaigns as part of this event. Some of us became its managing trustees. Some of the events that we have done, baby wearing walk, and we have participated in happy streets, and we have regularly had baby wearing discussions, cloth diapering discussions, baby-led weaning discussions, gentle parenting, menstrual cups, this, that. Yeah. So the support of mothers. So that's what I've had. And nobody gifted it to me. I made that group, me and my friends, we needed it. We made it. We made it happen. And it helped a lot of mothers during that time. And yes, our group has inspired a lot of mothers to start their own support groups in their own small towns also. I don't know how many of them have continued so long. Ours is 9 years long. I don't know how many of them are so, taking through or following up long term. But it's happening. In different places, it's happening. It's very important. Postpartum support group, peer group. Yeah. I would say more than anything, this is what is going to help the mother. She wants to hear from other people. It's okay. It's fine. It's normal. My baby's also doing it. Or there is a lactation consultant. I met her. You need to go see her. Or there is this mental health counselor. She's amazing. You have to go talk to her. Or my husband also said the same thing. Let your husband and my husband meet. He will talk to him. That level of support. And a lot of grandparents also come in. You can see some grandparents here in this photo. There are 2 people. There's one auntie sitting here. The previous photo also you can see grandparents sitting. They're also part of the discussions. Daddies are part of the discussions. So those were the three things I wanted to tell you. Birth plays a huge role. It all starts with the birth, then breastfeeding or lack of breastfeeding, whatever happens during that time. The third one is generally what all changes she goes through, her immediate environment, people around her, and does she have a support group or not. If you have any questions, you can ask me.
Ma'am, I have a question.
Yeah.
Ma'am, how do we prevent postpartum depression from happening in the first place, or like stop it at the very early stages, rather than letting it go to the later stages and then dealing with the consequences? Is there like any ways to prevent it from happening in the first place, ma'am?
Yeah. Best way to prevent is education. So during pregnancy itself, if a mother goes through a proper childbirth education class where she gets enough information about how childbirth is going to be, what all she can expect, if she's going to an institution, what all happens there, what are the protocols, what might happen, what might not happen, what she can do to prevent certain things. Let's say if she's informed that sometimes that baby can be given formula before initiating breastfeeding. If that information is given to her, she will make sure that she informs her family and the doctors that I want my baby to only have colostrum in the first 3-4 days of its life. I don't want any of you to give formula. That will be communicated properly and she'll get it right. So even if the baby is given one round of formula, she'll know, oh, because I was in post-operative ward and I needed time to recover, they gave once. It's okay, fine. I can go back and give lots of skin to skin and I can, get that bonding back. She will know. She'll be fundamentally very confident. So childbirth education classes and lactation classes, I would say mandatory, because we don't have that kind of information coming in from our family members. They also don't know. They would have gone through same institutionalized births and difficult breastfeeding situations themselves. And large volumes of people walking into hospitals. So they also don't have time to immediately, give individual attention to everybody and all. So one, she can take a call if she wants a natural birth or water birth or something like that. On the other hand, if she feels she won't be able to have that kind of an experience, at least with whatever she's having, she'll be able to make a better choice, because she'll know all the evidence-based practices, she'll know the best practices, she'll know the scientific, literature. Everything will be taught in a good childbirth education class. But yeah, 14 hours at least, 12 to 14 hours of instruction is very important. And lactation classes are also mandatory, because I've seen that a lot. In the hospital where I worked, I announced lactation classes every week. I had lactation classes, and I've always seen when mothers come and attend these classes after childbirth, when I go to their rooms, because I have ward to ward visit in every room I have to go. When I go visit these mothers after childbirth, the ones who have attended these classes are more confident. They don't need me much. They're latching and they're trying different positions. They're very comfortable. They've discussed everything with their husband, with their family members. They are more empowered to handle that situation. So childbirth education classes and lactation classes, I would say, is mandatory. And during pregnancy, maintaining a good nutrition, lifestyle, fitness. Very important to get a nice birth experience also. And your birth experience also depends on the kind of birth providers you have. So the kind of people that you're going to talk to, deal with, are they used to performing routine episiotomies, or will they take it as a case-to-case scenario? Do you even have the freedom to ask questions? Are they really aware of consent and boundaries? Are they asking permission before doing a pelvic exam? Things like that. So being aware of the kind of place that you go through, the practices that are followed there, all that will make her feel very empowered. And if she's having a nice birth experience and a nice breastfeeding initiation, I can confidently say so many cases of postpartum depression won't be there.
Okay, ma'am, thank you. Ma'am, we have some questions from the YouTube comment section. Participant is asking, what are some ways that physical therapy be included to address trauma in postpartum care?
Pardon me, what are some of the ways?
That physical therapy can be included to address trauma in postpartum care.
Physical therapy?
Yes, ma'am, like physiotherapy.
PT?
Yes, ma'am.
PT, I think being aware of all these things, when they give, let's say they are doing some pelvic floor rehabilitation after the episiotomy has not gone well, or because the mother feels she's having urinary incontinence or fecal incontinence or diastasis recti or any of these issues if she's having postpartum. During the counseling, if this PT also is aware of all these birthing issues and what happens in the institution and what would have led to what, and that knowledge, if this person has, knowledge of lactation, how things can go wrong and how breastfeeding issues are not only because of milk supply, there are other problems also that can come up. If that PT is also aware of these things during counseling, if they can acknowledge the mother's problems, I think that is more than enough. Basic psychoeducation, we can't expect all PTs, all professionals to have it, but I would say it's mandatory that everybody understands basic psychoeducation, because if the person's body is in survival mode, it's in fight, flight, freeze, then how much ever you try to teach them a kind of exercise or a practice that they need to be doing, even meditation for that matter, not everybody can do it. We have to acknowledge everybody should be trauma informed. So I would recommend going for some kind of trauma-informed classes, trauma-informed certification programs. Today, when yoga practitioners are going and getting themselves trauma-informed, multiple training programs and certification programs available here and there for being trauma-informed.
Thank you for the wonderful session, ma'am. I now request Mrs. Lavanya, Assistant Professor, to propose a vote of thanks.
A warm greeting to all. An attitude and gratitude begins the great things. I, Mrs. Lavanya, our Assistant Professor, Department of Psychology. I'm deeply honored and privileged to represent Chevalier T. Thomas Elizabeth College for Women and the Department of Psychology, and to extend my heartfelt gratitude as we conclude this morning session remarkably. International conference on prevalence and importance of maternal mental health globally, held in collaboration with IQAC of Chevalier T. Thomas Elizabeth College for Women. First and foremost, let us express our gratitude to the Almighty for orchestrating the successful commencement of the international conference. I express my gratitude to our esteemed keynote speakers, Mrs. Smita Rajan, co-founder of Tunai Trust, and Ms. Aisha Chandani, the founder of Mothers Club and managing trustee of Hidayah Welfare Trust for Women, and Mrs. Swati Jagdish, psychologist, lactation consultant, and sexuality health educator, for graciously accepting our invitation despite the demanding schedules. Mrs. Smita Rajan's views on perinatal distress, its prevalence, statistics, and how mother and child bond through the power of lactation, giving importance of maternal self-care, avoiding guilt or shame, and feeling that is completely normal and mothers are not alone or may reach out for help, as highlighted through the Suja story. Ms. Aisha Chandani shared knowledge on maternal health from the perspectives of the role of doula, importance of initiative, the intuitive brain of mothers, perinatal mental health concerns which can be dealt with empathizing with mothers rather than just knowing about it, and strategies to prevent the mental health concerns were very clear. Mrs. Swati Jagdish talked about the 3 points, which emphasized in detail about the birth process as the ideal as well as the critical scenarios, how to handle that, the breastfeeding grief due to child's trauma, and how to reach out for the support groups, tag the nail of the conference purpose. It gives a clear picture of the quote. I really saw clearly that for the first time why mother is really important, not just because she feeds and also loves and cuddles and even mollycoddles a child, but because in an interesting, maybe an eric and unworldly way, she stands in a gap. She stands between the unknown and the known, given by the Maya Angelou. So such awareness campaigns and the conferences would break the gap between the unknown and known. I would like to convey my sincere appreciation to our chairman, our humble justice, Thiru B. Gokuldas, former judge of the Madras High Court, and to our managing trustee and correspondent, Thiru L. Palamalai, IAS retired, for their unwavering support and blessings. I sincerely thank our esteemed principal, Dr. S. Sri Devi, and our vice principal, Dr. B.J. Quincy Das, for their steadfast support throughout the organization of this conference. My genuine thanks to deans,
heads of various departments, faculty members, students, and research scholars of various institutions who have been part of this conference as an audience and for the contributions. I owe special thanks to Mrs. Catherine, Head Department of Computer Science, Mrs. Jagdishwari, Head Department of Bachelor of Computer Application, and Mrs. Vijay Lakshmi and Ms. Jeevita, technical staff, who have worked hard along with us to ensure the smooth flow of this event. I also thank the students of Department of Psychology for helping with organizing this conference. Last but not least, I extend my gratitude to Ms. Alima Zara, Head Department of Psychology, Mrs. T. Shirley, and Ms. Fatima Samranam in the Department of Psychology, who have worked hard along with us to ensure the good stream of the international conference. Thank you all.